Yeah. Yes. Now, now here you hear a primary care physician. Primary care physician. Now let's go to these questions. You hear a primary care physician. So the medical professional is a primary care physician. Remember that. A primary care physician talking to a new patient. And the name of the patient is Jason Weiss. Jason Weiss. Now I'll teach you different things. Now there are many techniques which we have. Every technique I cannot teach you in every audio. So different techniques I teach in different audios. So be careful. Now this second session, don't think that this is the same like that one. I'm going to teach in a different manner, different style, different approach. Okay. Now let us see here. So, a primary care physician. Now, what is the logic behind why I am telling Jason Weiss and here primary care physician? Now, if you see, there are two people here. One is the medical professional, and the second one is Jason Weiss, the patient. So here two people are there. So in a in an OET listening test, you will have two speakers. So the first speaker will be a medical professional and the second speaker will be the patient. So if the patient is male, the physician will be female. If the patient is female, the physician will be male. So alternate. So gender will be different here. So first one is male, the second one will be female. First one is female, then the second one will be male. Remember that. So it is easy for you to identify. It is easy for you to identify. How can we identify? Now let us see here. How can we identify? Let us see here. Down. So let's go a little ahead. Jason Weiss. Jason. Is it male name or female name? That's what it is. Okay. Here. Anywhere, any personal pronoun is there, you have to say he or she. Check like that one. He or she is there or not. That we have to see. Okay. Now, mother, father. Okay, his father, his mother, nothing is there here. So NB, fracture femur in skiing accident, close reduction 5 years ago. Works as a dash. He is, she, not there. Treated with analgesia plus. Joint pain. Okay. So reports being a dash in childhood. Nowhere. Identified in lungs. Mild COPD diagnosed. In the early stage pulmonary fibrosis. Diagnosed. GERD. Subsequent difficulty. So here you can see there is no gender. There is no gender. Right. Now I want to show you something else. So in the previous one also we have seen one male, one female like that. So everywhere in part A, there will be genders. Okay, clash. One male, one female. So always remember that one. Write a point, this one. Be very careful. If you so that you can focus who is patient, who is the medical professional like that. Okay. Now. So he, here you see, he. Here it is not there. Here it is not there. But here it is there. Jason's not sure how to describe the sensation. So he says. So Jason is male. Jason is male. So I'm telling you different secrets in different tests. Remember that. So Jason is male here. So if Jason is male, Then the physician is female. Okay. Here you have guidelines, so we understood. But mostly it will be clear in the audio. It's here itself. Here itself it will be mostly clear whether it is male or female. Right? Remember that one. So his, he, her, she, okay, himself, herself, his, hers, like that one. These personal pronouns will help you understand whether it is male or female. So that's very clear. He. Okay, now he. Okay, then he. All right. So in the beginning itself, you will understand. So the doctor will talk to the patient. So this is a medical doctor will talk to a patient. So you can already see who is the doctor and who is the patient in the beginning itself. And mostly here also you will know whether the patient, why I am telling you, when you know onset of the condition, patient will talk. Onset of the conditions, the patient will tell when it came, left with a persistent dash, breathing difficulties, sensor. Who will tell these things? Patient. So these are the areas where subsequent difficulty dash and acid reflux. Who will tell? Patient will tell. The pulmonology referral. Now here there is a chance. Okay, patient will tell, but about those things, current symptoms. Okay, then family history. So you have to, maternal grandmother had. Who will tell about this one? Patient only. So now you will focus on the male voice. Mother recently diagnosed with. Who will tell? Patient will tell. So patient. So you here you will not bother about the doctor's voice, the female voice. Here you will not bother about the female voice. I'm telling you a different thing. What you have to focus, how you have to focus. Father deceased. So family history, who will tell? Patient only will tell. Doctors will ask a question, patient will tell. Now, current symptoms. Current symptoms. Okay. Now, current symptoms, joint pain, initially in dash, but not more widespread. Who will tell? Patient will tell. Patient will tell about the symptoms. Now, treated with analgesia plus dash. Current symptoms. Treated with analgesia plus dash. Treated. Okay. Sedentary lifestyle works as a dash. Who will tell about his work? Patient only will tell. So you try to understand. So where the information will come 90% from the patient. Remember that. I'm telling you different angle now. What I told you earlier is totally different from what I am going to tell you now. Don't think that this party sir has already told. No, this is entirely different. Entirely different. You can see. Okay. Now, diagnosed with onset of condition. This is past medical history. So who will tell about past medical? The patient will only tell. Doctor will ask question. Tell me about your condition. When did it come? When did it develop? What happened in the beginning? What you felt? So he will tell everything. Then he will tell what about the what next. So I was referred to something like that. So all these things patient will tell. So 90% of the information will come from patient, but the clues will come from the doctor. Questions will come from the doctor and answers will come from the patient. So question, doctor is asking some question. What happened? What happened? What happened? What were your symptoms? What medication did you take? What were you diagnosed with? What did the doctor say? Whom did you meet? Which doctor? So did he send to any, did he provide you any referral? All these things. What was there? Everything. Questions will be asked by the medical professional. Answers will be given by the patient. So remember, 90% will be patients. So focus on patient's voice. Focus on voice. That's what I tell you. All right. Now, right. Now let us see. 13, 14, 15, 16 questions now. So 4 questions. Go through these 4 questions now because I'm going to ask you once again. Take 1 minute and go through these 14 questions. Yeah. Right now, let us see these things. So, female physician, male patient. Patient Jason Weiss is male, and primary care physician is female. So you can focus on this voice, focus on the male voice more, because 90% of the answers come from male voice. Okay, right. Now let us see the first question. Onset of condition. Onset means beginning. Onset means origin, beginning of the condition. Bad cold developed into a chest infection when 18 months ago. So this is past medical history. Past medical history. Breathing difficulties. Dash. Sensation in chest. Dash sensation. What type of sensation? Sensation is noun. So before the noun, you will have the adjective. What sensation? Dash sensation. Some sensation. Breathing difficulties. Dash sensation in chest. So try to understand this. Now, if you see very clearly, now read it slowly with me. Breathing difficulties. Dash sensation in chest. So he had breathing difficulties. One example is dash sensation in chest. What type of sensation in chest? He's asking a type of feeling. Okay, what is the sensation? What is the sensation he is noticing? What is the sensation he is experiencing? Having a certain type of feeling in his chest. What is it? This is not a diagnosis, it's only a sensation. It is his feeling, it is his guess, it is his belief. This is not a diagnosis. We can already tell the patient here, Jason Weiss is describing a feeling. Yes, stop there. Now, the descriptive word. So the answer will require, the answer will need a descriptive word, describing what type of sensation. What is the type of sensation? How can you describe this sensation? Okay, is it itching sensation or irritating sensation or mild sensation or moderate sensation or intense sensation, as burning sensation? What type of sensation is it? Okay, what type of sensation is it? That's what it is. Now here you have to understand. Now look at the advice. Jason is not sure how to describe the sensation. He will say sometimes, sort of, kind of, maybe, might be. So is possibly. So that means he's not sure. Possibly. Possibly means might be possible, maybe possible, not sure, sort of, kind of, it is like. That means he's not definite, he's not sure, he's not guaranteeing, he's not 100% confident. He's just telling like that, what he's feeling is telling, but he's not confident. That's what you have to know. Sort of, kind of, like, maybe, might be, possibly. Okay, I think, I feel, like that. These words will tell you whether he is confident or just he is telling whatever he feels. That means, is it a fact or his belief, his imagination, or his guesswork? So that's what you have to understand. So you have to, you are listening for. Okay, he says sort of before using the word, sort of pain, sort of irritation, like something. So he is going to use such words. Remember that. So now let us see. Now, according to the advice, Jason's not sure how to describe the sensation. So he says sort of before using the word you are listening for. That's gold. Remember that. So that tells us exactly when to focus. When to focus. Okay, he says sort of, may kind of. That means the next answer is going to come. That's the cue phrase. That's exactly when to focus. That is the cue, hint, trigger phrase in the audio, and it will sound like, it's a sort of dash sensation in my chest. That word comes right after sort of. That's your answer. Now let us see grammar awareness. So now grammatically, the blank follows the article. Okay, article. Breathing difficulties. Sensation. Sensation is a singular. Sensation is singular. So it should be a sensation, because it's not sensations. It's sensation, countable, singular, not plural. Two sensations, three sensations, four sensations, senses, five senses, plural, five sensations. So that's plural. Sensation is singular. So you can think that it's a singular number. So A may come there. A burning sensation, or an irritating sensation, or an itching sensation. It depends. A or an. A or an. So article comes before there. Sensation. Sensation is a noun. Sensation is a noun. So A might come there. A or an might come there. An or a. Right. Next one is an adjective. What type of sensation? He is describing, okay, an adjective. He is using an adjective describing what kind of sensation it is. So the examples might be a tight sensation, a heavy sensation, a burning sensation, or a tightening sensation. So sensation is already there. So what you are supposed to write? A tight, that is the answer. And sensation is all a tight sensation. If you read together, a tight sensation in chest. So like that you have to read together. Now let us say a tight sensation, brainstorm. A tight sensation, a heavy sensation, a burning sensation, a squeezing sensation, a pressure-like sensation. So these are some cues which we can see. Now, what we have to do is, I have had this sort of, okay, burning sensation in my chest. It's a kind of like uh, pressure or tightness. Okay, so that's you understand, and you can log there during listen. So you have to be ready with, when you get the word sort of, be ready. Now then, quick reflection. Does my word describe a feeling or a symptom? Then it is correct. If it is diagnosis, no, it is wrong. So if it is, for example, infection sensation, no. How can it be infection sensation? Infection is a diagnosis. Okay, it cannot be a sensation. Pneumonia sensation. How can it be pneumonia sensation? Or asthma sensation. How can it be asthma? So you have to apply logic like this. Not pneumonia sensation, not asthma sensation, not infection sensation. It can be burning sensation, itching sensation, irritating sensation, mild sensation, moderate sensation, intensive sensation. Okay, like that one. So you have to think like that. Then it will be easy for you, right? It will be easy for you. Now, let us go to the next question. That is question number 14. Left with a persistent dash. A is there. Now in the previous question, sensation is there, a and an are not there. Now here he is giving a plus adjective. Before he did not give a plus adjective and he gave only noun. Now he is giving a plus adjective and he is not giving noun. So it is reverse of 13th question. Remember that one. In the 13th question, a burning sensation, a burning he did not give, sensation he gave. But here in the second one, 14th question, a burning, but sensation he is not giving. So blank. So there he gave noun and is asking for adjective. Here you have, he has given adjective persistent and he is asking for noun. So try to understand. In the first one he gave noun and in the second one he is asking for noun. Okay. And in the first one, he is asking for adjective, but in the second one, he gave the adjective persistent. So, a plus adjective plus noun. In the first one, first and second are not given. Third point is given. That is noun is given. In the 14th question, first and second, okay. So, article and adjective are given and noun he did not give. So, he may give any way like that. And try to understand that. A persistent dash. A persistent pain maybe, a persistent, something like that, a noun. Remember that noun should come. A persistent pain, okay, a persistent something else, okay, but it should be singular because a is there. It cannot be plural. It cannot be plural. It should be only singular. Because why? A is there. Earlier one, 13th question, sensation is there. Sensation. So A should be there, singular. But in 14th one, A is already given. So noun should be singular. Try to understand. How? Sensation given, you know that it is A, or is already given, you should know that plural S will not come. Okay, singular will come. So vice versa. Vice versa. Right. Now, for example, you are eating with your right hand. That means you will drink with your left hand. If you are eating with your left hand, that means you will drink with your right hand. Because left-handers, they eat with their left hand. Many people, they eat with their left hand. So they'll drink with their right hand. What's the problem? Okay. So that is how it goes. Alternate, alternate. Okay. So remember that one. Next, question number 14. Question number 14. Left with a persistent. So here now, my dear students, in question number 13, Jason described a feeling in his chest. Now in question 44, he is describing what was left behind after that. Okay, the lasting symptom that wouldn't go away, that wouldn't go away, it is continuous, persistent, it did not go away. Persistent means prolonged. Persistent means prolonged, so it is still there, it's going on, continuous, prolonged, non-stop. Okay, everlasting, continuous, that's what you have to say. It is a lasting symptom. It's not closed. It's not, it's still open. The problem is still going on. The symptoms still he is experiencing. That's the point you have to understand. Okay. Now this is a continuous problem. Okay. Left with a persistent. Right. What is it? Now let us see. So here Jason used two words to describe a symptom. Okay. Maybe. Now let us see here. Jason, go to the advice point. Jason uses two words to describe a symptom that he couldn't seem to shake off. That means he cannot get rid of the problem. That means it was persistent. Shake off. Shake off means he could not shake off. He'll say he could shake off. So he could not get rid of. That means it is on with you. It is going on. That means it is persistent. Both words. Okay. Persistent. Remember that one. So this is the way you have to understand. Left with a persistent dash. Now persist, continuously it is going on. What is that? What is that symptom? Now you have to understand the meaning. A thing that is going on, prolonged, prolonged. When patients say they couldn't shake off, that means something after a cold or infection, it is usually, what is it? Maybe it's a cough, maybe it's a wheeze, maybe it is a chesty feeling, or it might be a tickle in the throat. So it may be a two phrase or one phrase, one word or two phrase, right? A persistent, it must be a noun phrase, a noun phrase. So because in the ending, it is a noun, okay? It's a noun. So now you can use cough. There should be a noun like a cough or wheeze or a tickle. So this is a noun phrase because A is there and now there may be another word also. It may be another word also. What is that other word? It may be like another word, another adjective like word. What is that adjective like word? For example, dry, dry cough. Okay, irritating cough. Okay, or chesty wheeze, tickle or nagging. Some other word. Persistent already is there, plus one adjective plus one noun. A persistent dry cough, maybe a persistent, okay, something else, wheeze, okay, irritating wheeze, a persistent irritating wheeze, maybe. So maybe one word or maybe two words, a persistent cough or persistent dry cough. Okay, it may be one word or it may be two words, chances are there. Okay, but the example advice says Okay, based on the audio, it says use two words. Right. Next one. Now you see there. When you say the second word is probably a noun, and there is a first word that is adjective describing it. Okay, irritating cough, dry cough, like that one. So try to understand. Now let us brainstorm and predict the words. Let's brainstorm realistic options. Imagine you are a nurse, you know a lot of things. So you can say a dry cough, a chesty cough, a nagging cough, a tickly cough, a slight wheeze, a moderate wheeze. Okay, a persistent moderate wheeze. Persistent is already there. A is already there. A persistent dry cough or a persistent slight wheeze, like that. It may be anyway. So one adjective may come and one noun also may come. Okay, so you have to think what will it sound like in the audio. The Now try to understand the question. What is the sound like? How did you feel? The doctor will ask. Then the patient will say, even after the infection cleared, I was left with a persistent. Okay. I had a persistent problem. What was that problem? That you have to write there. Prolonged, continuous. It did not go off. Okay. It continued even after that. Cold. Got rid of cold, but he did, after effects were there. That's what. Okay. So when you are listening, when you hear the word persistent or couldn't shake off or ongoing or off, if you hear such words, then you have to think there are two words that you are going to hear and you are going to write those two words, but try to spell correctly. Capture the phrase first. Afterwards you can fix the spelling. Okay, your spelling afterwards you can fix, but first you try to capture what he's talking. Then once you capture, automatically you can write. Don't bother about the spelling immediately. Write whatever you hear, you write. Dry cough, DRCOU, like that one. Write short. Afterwards, dry. DR means dry. COU means cough. Finished. Okay, like that one. You can imagine. Right. So be careful. Now, this question strengthens your ability to differentiate between symptoms and conditions. What are symptoms? What are conditions? You have to understand that one there. Okay. Yeah. Next, we are going to the third question. That is 15th question. 15th question. Yeah. 15th question. Right. Subsequent difficulty dash and acid reflux nighttime and is there. And is there. So that means the word before and the word afterwards are somewhat related. So if acid reflux, what is acid reflux? Is it a diagnosis or is it a symptom? If it is a diagnosis, that means before also will be diagnosis. After and there is diagnosis. Then before and also it will be diagnosis. If acid reflux is a symptom, so it is after and. If it is symptom, here also it will be symptom. Now acid reflux, if it is a condition, medical condition, before also there will be medical condition. If acid reflux, for example, is a diagnosis, before also it will. So A and B, if B is diagnosis, A also will be diagnosis. If A is noun, B also will be noun. If A is adjective, B also will be adjective. Try to understand what I'm saying. They are related, like boys and girls, husband and wife, brother and sister. See, there is some sort of relation between them. Try to understand that. Pen and paper, black and white. Okay. Birth and death, and right, top and bottom. So there is some relationship between them. You have to understand because it is joined by the word and joins to related, equally related words. Noun, noun, noun and noun. Okay. Red and blue, red and tall. What is this nonsense you are talking, Mr. Peter? Red and tall? Red is a color, tall is an adjective. That is also adjective. Red is an adjective or it's a adjective of color. Tall is an adjective of, shape or height or distance or whatever it is, measurement. That is different. How can you use these two things in? Okay. So try to understand that. So they should be related in one way or the other. That's a must. Now here in 15th question, if you go to the advice, talks about losing weight and then describes another symptom. So what was he not able to do properly? What was difficulty? He was not able to do something. First, he talked about losing weight, unintended weight loss. That is one. Without his intention, weight he lost. Then he talked about another symptom and another symptom, dash and acid reflux. First one is unintended weight loss. Unintended means without his knowledge, he lost his weight. Then second one, subsequent difficulty in something and acid reflux. So two are there. So before also that should be there. What was he not able to do properly? He had difficulty, maybe breathing, a difficulty sitting, difficulty standing, difficulty walking, difficulty in doing something. So there is something called ing there. Okay. Difficulty breathing, right? And acid reflux. So here, now functional difficulty, some action. Okay, some action he found hard to do after his infection. Now, this type of question is common in OET listening because it measures how well you can hear verbs or activities that describe what patients struggle with. Okay. Now read this question carefully. Subsequent. Subsequent means after that. Okay. Consequent means as a result. Last. Subsequent means the next step. So first weight loss. After that some other thing. Next. Not the last one. The last one is something else. Okay. The last one is something else. He is not talking about subsequent difficulty dash and acid reflux. The next steps, because of his weight loss, the next one is this one, not the final. Okay. This is the next one. So for example, I had weight loss. Subsequently, I was irritated. So that is the next one. Consequently, I went to the doctor. So last thing is consequently. But the next thing is subsequently. Subsequent means sequence. The next in order. Subsequently means the next in order. Consequently means the last in order. Remember that. As a result of this, something happened. As a result, final. Okay. Remember that. The difference between subsequent and consequent. You should understand the difference between those words. It's very important. Subsequent means afterwards, not the last. It came after the earlier symptoms. So here the phrase and acid reflex. The first one, difficulty doing something and acid reflex. That's the thing. So now use the advice clue. Now the word properly. He will tell. Cannot properly. Properly means what? Try to understand it. Properly means 100% correct. Properly means 100% correct. So Jason talk and then describes another. What wasn't he able to do properly? So properly is the word. So he will speak the word properly there. So you have to catch that word properly. That means difficult, not able to, difficulty breathing. So I was not able to breathe properly. Try to understand this. I was not able to breathe properly. That means difficulty breathing. I was not able to breathe properly. Difficulty breathing. So try to understand. Okay, you have to be careful. You have to be little careful, cautious. This is a very tricky question. You have to understand. What is the action he couldn't do properly? And that's your answer. So difficulty swallowing maybe. Difficulty swallowing maybe. Because this is acid reflux. Remember this one. Weight loss. This is related to nutrition. This is related to food. Okay. So acid reflux. Right? Weight loss. Why weight loss? This is related to some food, digestion, nutrition. Okay. Right? Eating and drinking. So that you have to understand here. So now here, try to understand what is the word. Now grammar, if you see, the word will end in ing. The word will end in ing. So here, difficulty swallowing, difficulty breathing, difficulty sleeping, difficulty eating, difficulty chewing. So there is something coming with ing. So now if you think and you brainstorm, it might be difficulty eating or difficulty swallowing or difficulty sleeping or difficulty breathing. So this is the way how you have to analyze this question. So this is a logical link. So this time it is likely about another function, something connected to the throat or digestion since acid reflux follows. Okay. Earlier it was breathing problems earlier. Earlier it was breathing problems. But now it is something related to digestion. So logical link, a gastroesophageal symptom. It's not a respiratory symptom. It's a gastroesophageal symptom that's related to your throat. Okay. Now, now let us see. You have to listen to what? Now let us think how you are going to listen. After that, that means the next one. That means subsequently. Try to understand here. Subsequently means what you can expect there. After that, or then, or later, the next I face. So the next, later, after that, then. Okay. So these are the words which you will follow. He will not say subsequently, or he will not say subsequent. He may use some other word. Then, so the next thing I experienced was, after that, what happened is, so this is the way how he will speak. I have been having trouble. Okay, that's he'll tell. Dash and get acid reflux at night. As soon as you hear the words like couldn't or properly, or it was difficult, or it was impossible, I faced some difficulty. So these are the styles how you will get the word. When you hear such words, prepare yourself. The word that comes between them is your answer. Couldn't dash properly, couldn't breathe properly, couldn't drink properly, couldn't eat properly, couldn't sleep properly. So now it becomes difficulty sleeping, difficulty breathing. He will say sleep. Here you have to write sleeping. He will say breathe. I couldn't breathe properly. Here you have to write difficulty breathing. Don't write, I heard only breathe. I will write only breathe. That is nonsense because here difficulty breathe. No, it's not right. Difficulty breathing. Okay. Be careful. So grammar you have to check here. Sometimes you have to alter the vocabulary in a form to fit in the sentence. Okay. Right. Next one. Now, next question number 16. Question number 16. Now let us see. Diagnosed with dash and mild GERD, gastroesophageal reflux disease. Okay. or GORD or GERD, whatever it is. You can speak because spelling GORD or GERD, both are same, but spelling difference, American and English. Okay. OESO, that is British English. ESO, that is American English. So here he has given American spelling GERD. If it is British spelling, it is GORD because British spelling comes with OESO. Okay. Right. Now let us see question number 6. My dear students, this is an important question because it combines medical terminology with logical reasoning. It combines medical technology and logical reasoning. Try to reason logically and you should apply medical knowledge also. Now, you are not listening for a feeling anymore. This is a formal diagnosis given by a doctor because the word says diagnosed. Who will diagnose? Doctor only. Who will diagnose? Not a pharmacist, not a physiotherapist, not a nurse, not a head nurse, not a somebody else. It should be a physician or a doctor. Remember that. Doctor only can diagnose. So it is confirmed. It is not preliminary diagnosis. It is diagnosed. Means 100%. Preliminary diagnosis means 0% diagnosis. This is all just guesswork. 50-50. Maybe right, maybe wrong. But here diagnosed means perfect. Who can diagnose? Only doctors. So that means it is confirmed, made sure, no doubt, confident. Remember that. So you have to focus on these things. So the answer will be a medical condition. It's not a symptom. This is a medical condition based on the symptoms. He sees some symptoms and he'll say this is the diagnosis. This is not a symptom. This is a medical condition. And this medical condition is decided or determined or confirmed or diagnosed because of the symptoms. Remember that. So this is not a symptom. Symptoms will lead to the diagnosis. Now let us see here. It is linked to GERD. That means gastroesophageal reflux disease. This is not a symptom. This is a medical condition. Now let us see here. So this must be another condition connected to the same area, like, upper right? GERD and another one. Now let us see there. So connected to the same area. Now if you take the advice clue in number 16, Jason talks about a visit to the doctor and what the doctor told him. The doctor told him dash and dash. Two things. One, A, two, B. A and B both were diagnosed. A was diagnosed and B was diagnosed. Both were diagnosed. He was diagnosed with A, he was diagnosed with B. B is mild GERD. And A is also some other medical condition which, so both the diagnosis, they gave diagnosis, SES. Diagnosis means more than two, more than one. Right. Now it may be, you can say, for example, it is a noun. It is a noun. GERD is a name of a medical condition. So it is a noun. So the A also is a noun. For example, it may be what? For example, let us think like this. Okay. Parallel diagnosis. Parallel diagnosis. One is mild GERD and the same name of another condition. It will be a noun. Diagnosed with, for example, bronchitis and mild GERD. Diagnosed with asthma and mild GERD. Diagnosed with infection and mild GERD. Okay. So it may be bronchitis, it may be asthma, or it may be infection. Okay. Then now let us predict these words. Now we know that Jason had breathing difficulties and chest sensations. That is in question number 13. In question number 14, we see he had a lingering cough. Lingering means continuing, persistent. Lingering means persistent, continuing, ongoing, off and on. Okay, continuously. It's not, he did not get rid of it. It's still there. It's permanent. It's not temporary. It's not gone. Still going on. And he's experiencing that problem still. That's what it is. Now, if you see difficulty eating and swallowing. Okay, question number 5. Difficulty eating and swallowing. First one is about breathing difficulties. Second one is about continuous cough. Then third one is about eating and swallowing problems. Then next, acid reflux is there in there itself. Now next one. So these are connected to upper airway and chest conditions. All of these 4 are related to upper airway and chest condition. So what could the doctor have diagnosed him with before referring him to pulmonology? Pulmonology. So pulmonology referral. Try to understand. Pulmonology referral. That means this diagnosis sent him to pulmonology department. Try to understand. That means this is related to something lung. This is related to lung. That's why pulmonology. Next is pulmonology. See, we did not hear anything, but we are able to understand from the next word, next clause, pulmonology referral. So, based on this diagnosis, he was sent to pulmonology referral. Pulmonology means lung. Pulmonology. Pulmonology. Okay. So, now you can understand this is pulmonary respiration, means lung respiration. Cutaneous respiration. Okay. Pulmonary respiration means lung. Okay. So, pulmonology refers to lungs. You know that very clearly because you are. So, maybe it is related to lung. Gastroesophageal reflux disease. That's one. And the other one that is related to the first one, the main one. So it is related to lung. So maybe right, bronchitis, yeah, lung problem, asthma, lung problem, chest infection, chest, lung problem, maybe reflux disease. That is what gastroesophageal reflux disease or some other reflux disease. Laryngitis, larynx. So this is related to breathing problems. Maybe gastroesophageal disease is related to food. Gastroesophageal related reflux disease is related to food, and the other one is related to breathing is related to lung. So you have to analyze this like this, short and swift, because if you are a doctor, if you are a nurse, and if you are treating these patients like this long term, you will know a lot of knowledge. Okay, otherwise you can just hear and you can write. But if you, because you are medical professionals, you can guess. For example, if I sorry, not I, because I am already teaching, I can understand. But many other people, ordinary human being, if they are given this audio, they cannot guess. But you have lot of knowledge regarding this specific field, so that's why it is easy for you. It's not so easy for other persons who are not medical professionals. It's not easy because you have inherent knowledge regarding medical subjects. It is better for you. It is easy for you. It's simpler for you. But other people, it will not be easy because you have pre knowledge. Okay, knowledge, already existing knowledge. It is easy for you. Everyone, it's not easy. So make use of that knowledge which you have already. Don't just try to listen to the audio. Try to guess. Pulmonology referral. So it is related to lungs. What are the lung problems which are diagnosed? So maybe bronchitis, mild bronchitis, or mild asthma, chest infection, reflux disease, laryngitis. Now, when the test says diagnosed with, and after that mild GRD, so in between these are usually pairs, so two conditions that can coexist simultaneously, both, not only this but also this and this. The first one is this, the second one, there may be any type of relation, but it will be there. It will not be told, and he cannot say not only, but he can use anything else. Okay, right, at the same time. Okay, at the same time, during the same visit, during the same consultation, both these were diagnosed. So it may be mild and non-severe, maybe lingering chest or airway condition. That you have to understand. So these are the two. One is respiratory and one is digestive. GERD is digestive. So the second one is respiratory. And because of that respiratory, he has given referral to pulmonology. So remember that. So that's one short condition name, bronchitis or asthma. It may be mild or moderate or severe. Anything it might be. So remember, it may be one word or two words. No problem. So during listening, the moment you hear diagnosed with, stop thinking. Don't think about anything else. Be ready. One medical term will come immediately after that. Take it, write your answer. Now think about this one. Reflect. Does my answer sound like a condition or a symptom? If it is a symptom, gone. It's not. If it is a condition, then it's right. Does it fit naturally with and mild GRD? Connection, both together, put there together. So what is that? Bronchitis and GERD. Bronchitis is a medical condition. It's not a symptom. Bronchitis is a medical condition. So finished. That's the right answer. Like that, you have to think. If it's like something like pain and lightness, or that's too general and that will not fit in the answer. Now let's go to 17th question. Now go to 17, 18, 19. Three questions. Go through these three questions. 17, 18, 19. Okay, 17, 18, 19. Pulmonology referral. Three questions are there. Go through those questions now. Now, 17th question. So, 17th question. Now let us see. The question is a logic test. Okay, now let us see. Dash and early stage pulmonary fibrosis ruled out. Again, there is end here. So in 15th question, there is end, and 16th question, there is end. Try to understand this. Two things are going on together. It will help you and it will make your answer easy. If you think, what is the second one? First one will be like the second one. If first one is given, what is like first one? Second one will be like first one. If first one is a noun, second one will be a noun. If second one is a verb, first one will be a verb. If first one is an adjective, second one will be an adjective. If first one is a diagnosis, second one will be diagnosis. If second one is symptom, first one will be symptom. So symptom A and symptom B. Diagnosis A and diagnosis B. Like that. You have to understand. Noun A and noun B. Adjective A and adjective B. Like that. They are always related. So remember that and is a very special setting which will simplify your task. So first, what is the second word? You can understand the first word. Remember that. Okay. And keep it in your mind always. Always. Okay. Now, if you understand the blank condition, we must fit. There are two things. There are two things. Dash and early stage pulmonary fibrosis ruled out. Two things are ruled out. Early stage pulmonary fibrosis ruled out. Early stage pulmonary fibrosis ruled out. And in the similar way, another one also was ruled out. Okay. Another one also. Yeah. So both are ruled out. Both are ruled out. That means he said, no, this is not right. No, this is not right. They are ruled out. Okay. Now, let us see here. Now, understand the meaning. So, the blank is another possible lung disease because the referral is to pulmonology department. So, if the second one is early stage pulmonary fibrosis, the first one is also related to pulmonology. That means lungs only, because both, this is a pulmonology referral. He will not bother about a digestive system. He will not bother about some other exercises or food or something. No, he is bothered only about lungs, because it's pulmonology referral. The specialist related to lung specialist. So lung specialist will deal only with the lungs. So there are two things here. The first one is related to lung, and the second one, both are related to lung. That you have to understand, because it is joined with and the title pulmonology reference says that it is related to lung. So based on this, both are lung related diseases. The second one is lung disease related, so the first one is also lung related disease. So both the lung related diseases are ruled out. Then what next? That is the later thing, but that is the next question. But here, what are ruled out, we have to understand. Now the doctors tested for two things, and both were, they could not find both of them, so they ruled them out both. Now let us understand the meaning. When my pulmonologist rules out conditions, it usually means they ran imaging spirometry tests, that lung scans or breathing test. So here, now once again I'm telling you, when a pulmonologist rules out conditions, it usually means they ran imaging or spirometry tests, that is lung scans or breathing tests. Try to understand. That's why they conducted these tests and they did not find any result, so they ruled them out. No, this is not the problem. This is also not the problem. So two problems were ruled out. Okay. Now, after running the test, now if fibrosis, okay, fibrosis, pulmonary fibrosis. What is this pulmonary fibrosis? Fibrosis means lung scarring. Fibrosis means lung scarring. You should know that. It was ruled out. The other likely possibilities would be maybe asthma, pneumonia, bronchiectasis, or emphysema. Suppose there may be many other problems that you should know. I am giving you some things which I have knowledge of. So it may be asthma, it may be pneumonia, it may be bronchiectasis, or it may be emphysema. So all of these are respiratory or lung related conditions. Now let us see grammar awareness. Now if you see grammar awareness, look at the structure again. Dash and early stage pulmonary fibrosis ruled out. So the missing phrase must be another noun or medical condition. Another noun or medical condition. Right. A single condition name, or at most a short phrase, two words. It may be, for example, asthma or chronic bronchitis. It may be asthma, one word, or chronic bronchitis, that is second word, two words, or lung cancer, two words. So, lung cancer. So, it may be any of these things or like this one. Now, let us brainstorm. So, now, so if we study Jason's case, now we have past chest infection, we have persistent. So Jason has past chest infection, he has persistent cough, he has reflux. Now being seen by a pulmonologist. Now what do pulmonologists usually rule out first? They first rule out asthma. They rule out emphysema. They rule out fibrosis. They rule out infection. They rule out bronchiectasis. These are the things which they first rule out. Okay. So the question says early stage pulmonary fibrosis ruled out. That means fibrosis is one, and the other must also be a chronic lung condition. It won't be a digestive or cardiac issue. It will be only respiratory, because it is treated by, it is examined by a pulmonologist. He has gone to a pulmonology department, lung department, and the specialist is lung, okay, doctor, okay, specialist. Now remember the question, what does it say? Okay, that's it. That's very important. Now, if you focus on the listening part, now he will say like this. Maybe you will hear like this. What you expect to hear? They ruled out asthma and early stage pulmonary fibrosis. Or they can say the scans came back clear. The scans came back clear. That means we sent for scans. The reports came back and they were clear. There were no signs of dash. And there were no signs of early fibrosis. So this is how you will listen. So you have to be ready. You should know what. I also did not play the audio. We can guess like that one. You are doctors, you are nurses, you are professionals. You should guess like this because you know better than me. Okay. Right. Now, as soon as you hear the word ruled out or cleared, no chances of, okay, no signs of, then that means you should be ready. You are close to your answer. And the answer will come before that phrase. It is what that was ruled out. Okay. So now during listening, you have to think about all these things. The first one mentioned, that's your answer. Okay. The second one mentioned is already there. So no need to bother. So it may be coming beginning and after. First and second or second and first. Any order he may give sometimes. So be careful. Don't think the first one will come first, second one will come second. No. Sometimes that and this may come here and there. Okay. Boys and girls are girls and boys. Pen and paper or paper and pen. Chairs and tables or tables and chairs. Whatever way you speak, that doesn't make much difference. They are related and that's fine altogether. Their position will not alter. Left and right or right and left. So that doesn't matter. Next. Now let us think here. Yes. Now you have to have a quick reflection. Does my answer name a lung or respiratory condition? Does it make sense to be ruled out by a pulmonologist? Yes. Then it's perfect. If it is something like heart disease or acid reflux, it doesn't fit this context. If it is a heart disease, okay, it doesn't fit this context because this is pulmonology department. Heart disease is different and lung disease is different. If it is heart disease, he will go to a cardiologist, my dear. Try to understand what I'm saying. Relativity, relationship, the collaboration one with the other. Pulmonology will be the lungs. He will not deal with the heart problems. Heart problems will go to cardiologist. Brain problems will go to craniologist. Nerve problems will go to neurologist. Don't we have common sense? Can't we rule out these things? Do we need the audio? No, even before the audio plays, we can guess these things. That's the point. So cool down. You are professionals. You can guess. You cannot be like some other people who are laymen. Be active brains. Active brains. Don't wait for the audio. Before the audio starts, do your background work. Before the match starts, you do your rehearsals. A person who doesn't do his rehearsals is dead in the battleground. Try to understand. Sure, the audio starts. When the audio starts, strike it and give it a blow. The head will roll off like a Bahubali. I don't know whether you know Bahubali movie or not. It's a famous movie. Watch it. Okay. Strike it. One stroke and the head should fall down. That's a master stroke. And this is grand master class. That makes the difference. Okay. Right. Now, that's it. That's it. Now, what will the doctors say here? This is a classic OET diagnostic question. Remember that. You are not being tested on what was found. Okay. You are not being tested on what was found, but on what was excluded. Exclusivity principle, deduction, not induction method. This is deduction, means minus, 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 minus. Maybe, maybe no, maybe not. Not even maybe not. It is not. Maybe not means 50%. Yes, 15% wrong. But it is not acid reflux. It is not bronchitis. It is not GER, it is not something like fibrosis. It is not fibrosis. It is not fibrosis. Fact, fact, fact. Okay, try to understand this. It was what was eliminated. Elimination technique, we call it. Elimination technique. Try to understand. It is not diagnosis, but it is not It is what is eliminated. Diagnosis means confirmed, but this is confirmed or not. Try to understand this. Confirmed or not is not diagnosis. Confirmed or not is not diagnosis. So fibrosis is not confirmed. So this is not fibrosis. Doesn't mean that it was something was diagnosed. No. So you have to do further test to diagnose. Try to understand this. One item is eliminated. It doesn't mean that the patient is diagnosed with 100%. No. It is still 100% not diagnosed only. Something is ruled out means something is eliminated. So you have to think for other options, what else might be there. This is only the beginning of the story. Diagnosis means ending of the story. Elimination means beginning of the story. Try to understand, my dear doctors and nurses. This is your game. Play it well and you will master it. So we have done 17th question. Now we'll move on to question number 18. 18. Question number 18. Now let us see. Dash identified in lungs. Dash identified in lungs. So discovered, identified, confirmed. Everything is fact. 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 Okay. This is fact, it is there. Earlier one fact, it is not there. Earlier fact, it is not there. This is fact, it is there. That means this is confirmed diagnosis. That is not confirmed anything, but only something is eliminated. First stage is elimination. This is not right. That's confirmed. But diagnosis is not confirmed. But something is not there, that is confirmed. Okay. Confirmation doesn't mean that it is diagnosis. Confirmed that this is not this disease. Okay, that's the beginning of the story, and this is 18th question is the ending of the story. Okay, diagnosed. Yes, it is there. First one is no, it is not there. 18th one is yes, it is there. Identified in. What was identified in lungs? What was identified in lungs? That you have to see here. What was identified in lungs? Mild COPD diagnosed. So, what is this? Obstructive pulmonary disease. 1 minute. What is the full form of this? I just lost it. Obstructive pulmonary disease. 1 minute. Chronic obstructive pulmonary disease. 1 second. I'm not sure. 1 second. Let me check. COPD. Chronic obstructive pulmonary disease. Am I correct? Chronic. Yeah. Doctor Arslan. Not Arslan. What is his name? There's one doctor. Let me see. Shamsa.
Yes.
Chronic obstructive pulmonary disease. Is that right?
Yeah, it's fine. Yeah, that's great.
COPD. No.
Yes,
Are you
UBD.
100% sure?
Yeah, yeah. Chronic obstructive pulmonary disease. Yeah.
Okay, I am slight doubtful. That's why I asked you. So, because you are a medical professional, you can confirm with it. So, chronic obstructive pulmonary disease. Okay, fine. Now let us see this. Let us go to this edge and 100% final stroke. The tree is going to fall down. This is confirmed 100%. Finished. No more arguments. No more doubts. Everything is perfect. 100% done. Done. First one, 17th is 0%, but 18th is 100%. That's it. Now, dash identified in lungs. What will you identify in lungs? And based on that one, you can diagnose that it is COPD. Okay, it may be inflammation, it may be scarring, it may be obstruction, mucus buildup, airway narrowing, and there are many other possible things which are indicators of COPD, indicators, signs and symptoms which say that this is COPD. Based on these indications, there may be inflammation, there may be scarring, there may be obstruction, there may be mucus buildup, airway narrowing, whatever it is. This is chronic obstructive pulmonary disease. These are indicators. These indicate that it is COPD. Any one of these, all of these are possible Inductors of CO. Inductor, indication, indicate, sign, symptom, signs and symptoms, signs, symptoms, indications, markers, suggesters, okay, pointers, they are all pointing towards COPD. So any of these words, because you are medical professionals, you should mentally map these words and tuck 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 tuck, they should come on to the forefront on the screen of your mind. And then when the word comes, grab it. That's the difference. That's the difference. Next one. Now let us see grammar awareness. Now let us focus on grammar. That third step is grammar. Now grammar, now here, dash identified in lungs. What is identified in lungs? It is a noun. It is a noun or a noun phrase. Noun or noun phrase. Most probably it is a single word. Something identified. What is identified? Scarring is identified. Damage is identified. Blockage is identified. So try to understand. Maybe these also. Something identified in lungs. And that is mild COPD diagnosed. It's mild, right? So dash identified in lungs means the blank must be a noun phrase. Something that can be found or seen or noticed or observed or detected. Found, noticed, seen, detected, observed, identified. All these words, they may speak any other word, but these words should strike on the directly. They should strike your mind immediately. So he may use any other word. Identified, noticed, observed, detected, seen, found, discovered. I can give you any number of words like that. 10 to 12 words or even 20 words, we can one by one they will come. But all these words are not important. How your mind is reacting to that word is very identified. He says detected. Detected means identified, discovered, noticed, observed, found, discovered. Yeah, that's how you have to catch it. Okay, one word he says and you have to catch. That means you should know multiple words to catch that one word. If you don't know, then if you don't think in that angle, diverse angle, it is very difficult for you to catch this particular word. That's the difference. Be very careful. I told you I'll not, every time I teach, this is a different one. The earlier lecture was different. This is different lecture. This totally different style. You know that. I'm not teaching like how I taught the first step. This is different one. This is okay, fast and furious steps, right? Now, so that's uh, uh, diagnose, finish. Now how you are going to medical finding? It is a medical finding. It's not an action. It's not a feeling. It's a medical finding. Okay, right? It's a medical finding. It's a sign and symptom. It's a indicator. It's a marker. It tells you something. If you see, for example, if you what do you say, 1 minute, for example, if you see on the road, if you see people with long hair, that means a girl or a woman or a lady. If you see a person with a short hair, that means it's a boy or a man. Okay, so you have some indicators, no? By looking at something, you can see, for example, if you see a tail of a tiger, you can say this is a tiger. So the tail is the indicator of the animal. If you see the tail of an elephant, you can say, this is an elephant. How? How can you say? You just see the tail coming out of the cave or behind a tree. Behind a tree, there is a lion and its tail comes out. You can see the tail. Will you say, this is a snake? That means you are mad. You are fool. You are, imbecile. You don't have knowledge. That's the meaning. So you look at the tail and you say, this is a lion. This is a monkey. How? Because they are signs and symptoms. You need not see the entire thing. So try to grab that in. You have that inborn. Every human being has this knowledge. But how we are using this knowledge is very important. Once again, I'm telling you, I'm masters in English literature. I'm masters in English literature. That means I'm specialist in English. Not only that, I am certified English teacher. That means teacher training. I have two master's degree, I have two bachelor's degrees and two master degrees, and I have come out successfully with a university 8th rank. Okay, with English, maths people get first rank, second rank, third rank, but I with English has competed with them. So you can understand. Yeah. So psychology is my special subject. I got first rank in the university in psychology. I can tell how the mind works. Your mind works very perfectly. No doubt. But you don't have that confidence. If you attack it confidently, you can do miracles. I'm not a doctor. But I'm not a doctor. But when I search in it, I can get all these things. I can understand. And with experience, I can gain, confidence. That's what it is. Now you are not English people. You are not English professionals. You are not English teachers. You are not regular English students. But still, if you practice, if you have that confidence, you can grab everything like that. Okay. You never saw a real tiger, maybe, but still, in the movies, if you see tiger, then if you see the tail, you can say this is tiger. That's it. Okay. That's it. That's very clear. You can differentiate what it is and what it is not. Signs and symptoms. If you see the tail of a tiger, you will say, this is not a lion, this is not a monkey, this is not an elephant. This is what the last option is, tiger. That's all. You'll tell 1,000 no's and one yes. That's the confidence level. You should the same confidence level you will get here also, because you are professionals trained in the subject. If a teacher or a lawyer or an engineer comes and studies this subject, it is difficult for them. But for you, you have been born in this department, and you are there in this department, and you are experienced in this department. Your life is there 100%. So you are expert in these things. So don't be low confident. Be perfectly confident. That's what I tell you. Just go ahead like that. See, when I am not a medical professional and I am so confident, so how much more you should be confident? That's what I tell you. Now let us see. Let us brainstorm and predict. So it may be lung damage, it may be airway obstruction, it may be reduced airflow, and it may be inflammation, it may be mucus deposits, it may be hyperinflation, it may be one word or two words, it may be phrase or a single word. Try to understand that. Right. Next. Question number, remember, COPD is a progressive airflow limitation. Remember that. COPD is a progressive airflow limitation. Remember that. So anything that shows blockage, narrowing, scarring, or obstruction fits the logic perfectly. Logic, logic, logic. Think with your five senses. Don't just guess nonsense. Think with your five senses. Then you can understand it very clearly. Now, next, when you are listening, what will they speak? How will they sound like in the audio? It will be like this. You have to expect like this. They said there was something dash, and they found it in my lungs. They scanned my lungs, and they took an x-ray, and they did what all I don't know. They ran some tests, and afterward they said, what, there was some problem. What was that problem? There was a limitation in the airflow. There was scarring. That you have to understand. When some of these words come, you should be very attentive. Then they found, they discovered, they identified, they noticed, they observed, they detected. Any of these words come, be very attentive. Start listening from there. Till then you hear. But when you hear these words, start listening. What is the difference between hearing and listening? I'm telling you the depth points beyond listening, and I'm talking fundamentals of technology, fundamentals of techniques, okay, communication techniques. How will you understand when somebody is speaking? That is called dynamics of speaking and listening, dynamics of articulation. We call it dynamics of articulation. So Try to understand this very clearly. He's telling, so when you hear the word, immediately you have to be ready for those things. So listening and hearing. What is hearing and what is listening? For example, you are in a bus, or you are in a classroom, or you are in a cinema movie theater. You are in a movie theater, or you are listening to a radio in a public park. Everyone will be shouting in a bus, but you are talking to your friend next to you. Everyone's voice you can hear. You can hear the bus around, bus, squealing, and you can see the horns buzzing. You can see the buses whizzing past, and you can hear others speaking. Somebody is talking on the mobile phone. Somebody is shouting to the conductor. So conductor is telling ticket, ticket, ticket. So lot of things are going on. You hear each and everything because you cannot stop from hearing, because hearing is common. Hearing is natural because there are some holes in your ears, the duct which takes from outer environment into the eardrum. You cannot stop it. The hearing is a natural process. Even if you don't want to hear, you will hear, unless and until you are plug your ear holes. You have to plug your ear holes. Then you cannot hear anything. Unless and until you plug your ear holes, you will definitely hear. There is no excuse. That is called hearing. You don't need any effort for that. That is hearing. You hear everything, sense to nonsense, loud and small, big and long and short, everything you hear. But listening is with effort. Listening with his intent. Listening is with interest. Listening is with that burning desire. I don't want to miss what you are saying. That type of attitude. But hearing is, I don't bother type of attitude. Everything I'm hearing from morning to evening, what is there? That's it. Even the air whizzing, you hear. We don't bother. But when you want to listen, your all ears, your full body listens. We say we are all ears. For example, you remember when your small child is telling Papa, you remember your whole body, freezes. Yes, you'll stop everything and listen to your child. Or when your habibi or your husband or your lover or beloved or mother or father or brother or sister, those whom you love too much, when they call you, even slow voice, in spite of the heavier voices, lofty voices, big voices, nonsense, nuisance, everything, rumbling sounds, you hear this soft voice ringing in your ears because you are 100% concentrated. That is called listening. Try to understand what's the difference between listening and hearing. You hear everything, but when the word comes, listen to it. Listen to it very carefully. You will not miss a bit. You will not miss it. You will not even ask, I did not hear. No, you will definitely listen to it. That is called respecting those words which you ought to hear, because you love to hear those things. You desire to hear those things. You want, you demand, you need. It is do or die for you. These particular words. So these answers are do or die for you. The rest everything you hear. But when these words come, you start listening. Till then you hear. But when you smell these words, when you taste these words, when you track these words, those are triggers which activate like hormones in your body. Try to understand this. This is psychology. This is psychology. Then you will never. Why this Dunisha or Dinusha? I don't know. She got 12 out of 12. Why most of them got about 10? Nobody got 9. Why? Because listening with concentration. That's it. And before that, you planned very well. You planned a good plan. Without a plan, you cannot go a building. So this 30 seconds, you have to plan very perfectly, fast and furious. That's what I tell you. So, next. Question number. Yeah, during listening. Okay. Now let us see here. What will you listen there? Question number 17 over, na? 5, okay, dash ruler. Question number 18, diagnosed. Question number 18 is diagnosed. Okay. So there. So question number. Okay, 1 second. Question number 18. Dash identified in lungs. Dash identified in lungs. So now we already finished, I think. Yes. Question number 18. Where am I? Okay. Yeah.
19, sir.
Yeah, question number 18. Yes. Now we are moving to question number 9. So it may be inflammation. Once again, let us brainstorm and pray. Lung damage, airway obstruction, reduced inflow, inflammation, mucus deposits, hyperinflation, or some. Remember, COPD is a progressive airflow limitation. So logic is perfect. Now you have to listen. What are they saying? You should say, they found a bit of something. Now, during listening, you have to hear these words identified in lungs. When you hear these words, immediately trigger yourself 100%. Till then, half, but then 100%. Okay, fully you have to explode and be ready. Dash found in my lungs. Remember that. Identified means found, discovered. Synonyms. So learn the synonyms. Synonyms are very important. The same words will not be there. So for every word, try to learn similar words. I'll give you a lot of the, for example, found, discovered, identified, observed, noticed, detected. Okay, that's how you have to be ready with all these words. One word here and another word there. How can you compare immediately? If you are fast, then you can gather this. Otherwise, you will miss the answer. Be very careful. Now, in the end, quick reflection. Is this something a doctor could see or detect on a scan? If yes, perfect. If it's a feeling or a general term like pain or pressure, that's not the right answer. So think about these things in that manner. Next question, number 19. Yeah, 19. The last 4 questions. 19, no, last 6 questions. Yeah. So 19 to 24. Yeah, here we are, 9 to 24. So now 19, reports being a dash in childhood. Reports being a dash in childhood. A dash. A is there. Article. So next one is a noun. Reports being a dash in child. When he was a child, he was a dash. Okay. A dash. Okay. Reports being a slow learner. Okay, maybe something like that. Noun. A plus noun. A book, a pen, a table, like that one. So reports being a dash. Reports being a dash in childhood. Think about this very carefully. So silently you read this question very carefully. He says, be careful in the 19th. Okay, advice. Be careful on the right side. He says, be careful. The answer is a two-word expression with a specific meaning. One word is not enough. One word is not enough. So you have to write 2 words. Be careful here. Okay, 2-word expression is not 1-word expression. Okay, being a dash in childhood, slow learner, fast learner, maybe. Okay, or a light sleeper. Okay, something like that. 2 words there will be. So you have to be careful. Now, let us see the clue there. If you see the clue there, the answer is a 2-word expression. That's very important. You have to understand here. So it means you will hear 2 short words that go together. Okay, something like passive smoker. No, that will not suit. Okay, because it is a small boy as a child. Okay, in childhood. So passive smoker, passive may be right, because passive smoker, father is smoking and he's smoking his father's smoke, exhaled smoke. Passive smoker, yeah, that's right. He's not an active smoker, but he's a passive smoker when he was a child. 3 years, 4 years, father is a chain smoker. He's smoking in the house also. Nobody is there to object his smoking behavior, and nobody is there to correct his attitude. So what happens? What happens? So there is smoke all over the house, in one way or the other, at one instance or the other instance. The child will inhale the exhaled smoke, passive smoke. And passive smoking is even more dangerous than active smoking, because all the things which are there in the body, they come out along with the smoke. Yeah, the bacteria may be inside his lungs or whatever is there, maybe that's exhaled, and it's even more dangerous. That's what research says. Passive smoking is even more dangerous. Okay, active people don't smoke, but those who don't smoke, when they smoke the exhaled smoke of others, they will get cough too much. Okay, so that's there. So that's the point. A passive smoker, maybe farm child is growing in the farm. Okay, or sickly kid, or asthmatic child. So there are two words together. You have to catch those two words. Okay, you have to catch those two words, and both of them will come together. Remember that. Okay, it's a noun phrase. Okay, noun phrase, adjective and noun. A dash. Okay, a asthmatic kid. No, an asthmatic kid. So asthmatic kid will not go. So whenever there is a word called a, the next word will not start with a, e, I, o, u sound, not letters. Okay, not letters. Letters may be there, but sound, I'm bothered about the sound. Pronunciation. A university's boy, university student, a university student. You can come, university, UNI, but the pronunciation is you, YOU. So I'm talking about the pronunciation. A university student is right. Sir, you said AEOU, AEIOU will not come. But here, university student, U is there. No, I'm not talking about the spelling, my dear. I'm talking about the pronunciation. When you say university, university, YOU, U. So Y is there, the first letter, not U. In writing, you use U, but in speaking, you pronounce Y first. University, YOU, U. That's it. So try to understand that one. So it's a matter of pronunciation. When A is there, article, the next one will be pronounced with a consonant sound. Yes. Okay. Vowel sound you will not get. So asthmatic child will not sit here. Okay. A neglected child. Yeah. A neglected child. Yes. But a forgotten child, a disregarded child may be coming. I'm just giving you examples. A Indian will not come. A English child will not come. A Indian child will not come. Try to understand what I'm saying here. Vowel and vowel sound, they won't match together. Vowel and consonant sound, or consonant and vowel sound. That is why a, an is there. For vowel sounds, you use an. For consonant sounds, you use a. Remember that. A is already there. So the next word should be consonant sounding beginning. Remember that. Okay. A asthmatic child will not come. Okay. So like that one. Next. A passive smoker. Yeah, correct. A active smoker will not come because A and active don't match. A passive smoker, A and P. P is a consonant, A is a vowel. So they will match vowel and consonant and vowel. That is the relationship you have to understand. A is there, it is helping you to exclude the words beginning with vowel sound. So try to understand. So I'm giving you further clues. This is not the same like first I have taught. This is totally different one. Yeah. Next. So here it is a condition. Being, B is a condition. B is a state. I am helpless. That means my condition is helpless. I am helpless. I am active. My condition, active condition. I am in active condition. It is useless. Its condition is useless. It is useful. That means its condition is useful. So it is a condition. You're talking about a condition. B was being. Am was being. Are were being. It is a state or it's a condition, we call it. Condition. So now, if you see here, reports being a dash in childhood. When he was a child, he was a dash. His condition, what was his condition? His condition, passive smoker condition, because that's it. So, what was his situation? What was his condition? What was the problem he faced? That is his condition. So, or second one is exposure. First one is a condition, asthmatic child. That's a condition. Or second one, exposure, passive smoker, smoking, exposure to smoking. Or a role or environment. What is role or environment? Farm child or city child. Farm child or city child, urban child or rural child, like that. So it is based on the environment in the society. So, right? Next. Being a well-nurtured child, low-nurtured child, like that, anything it may be. So you have to be ready. So let us take some examples. So city kid, that means pollution exposure. That's why asthma related to pulmonary problems. Remember that asthmatic problems. So, city kid, pollution to exposure. Farm child, allergy to pollen grains or allergy to some smells. So, farm child, his allergy. So, breathing problems. Pollution, breathing problems. Asthma, breathing problem. Smoking, breathing problem. So, try to understand the related things there. Okay, try to understand the related things. Now let us see. Now think about the cause and effect. Think about the cause and effect. This cause, this is the reason. In the childhood he had this condition, so that's why he had these lung problems. So that was the cause and this is the effect. Lung problems is the effect and this is the cause. So this is a causal relationship, cause and effect relationship. Try to understand the relationships. Write down somewhere. This comes many places. Cause and effect relationship. Write down. So cause and effect we call it. So the effect or the result is what? The result is what? He has lung problems. And the cause is what? He is a city kid, too much of pollution. He's a farm child, dust is there, allergy is there, exposure is there, allergen like pollen grains or cat dust mites, cat fur, something like that. So allergy because of that things, and because of that one he has breathing problems. Asthma is a genetic problem, okay, or hereditary problem, or personal physical problem. Then passive smoker, exposure problem. He's exposed to smoking. He doesn't smoke, but he's exposed to smoking because he's helpless. He cannot fight it. He has no other option here. So like that one. So this is cause and effect problem. Remember that. All the things you have to think. So I was actually dash when I was a kid. I think I was what you called a dash in childhood, a passive smoker in childhood, like that. In childhood, okay, or when I was a child. So before or after that, When I was in my childhood, I faced some problems. Actually, my father used to smoke a lot. He was a chain smoker. Every time the rooms were filled with smoke, and accidentally, unfortunately, I used to smoke the exhaled fumes, and maybe that is one reason. So that's it. A passive smoker. So you have to realize that one. You have to gather those words like that. Okay. Think, think, think. The more you think, the better you are. If you get 24 marks in this, that's enough. You have got a jackpot. You have got a jackpot. So target 24, at least 22 you will get. Okay. Target 24 out of 24. At least a 22 you'll get. The least. See, morning you targeted 12, you got 10. Nobody got less than 10. Like that. I'm targeting you 12, so you're getting not less than 10. That's it. So you target 24 out of 24. You'll get at least a 22. That's it. There's no doubt regarding that. If you get 22 in this one, that means in B, you can get 2. In C1, you can get 2. In C2, you can get 2 very easily. Out of 6, 6, 6. Out of 18, can't you get 6? Very easily you'll get. So don't worry. So target 24 out of 24 in part A, because these are the easiest questions. If you apply my mind to your test, you can definitely don't take these things very lightly, because I'm taking, see, midnight oil. I'm burning my midnight oil. You know what is the time now? It is 4 o'clock in the morning. It's 4 o'clock in the morning. Try to understand this. I'm burning my midnight oil. I'm not bothered about my sleep, because I know you are very precious to me. You are very precious to me. You are my bread provider. So I'll give you all the best for you. That's it. So don't ignore my suggestions to you. We have completed part A now. These were 24 questions. That means you can go and test. You can go. These are the rehearsals. You can go and practice on your own for 1 week. By the end of 1 week, you will master these things. And that's it. Still, if you have doubts, you can ping me anytime on WhatsApp. Right. So that's it. So next one. Question number 20. Joint pain. Joint pain. Now, this is current symptoms. Joint pain. Initially in dash, but now more widespread. So joint pain. Joint is a body part. Which joint? Initially in which joint? Joint pain is there. In which joint? In which joint? Huh? In which joint? That you have to understand. Is it hip joints? Is it elbow? Joint is there where two bones meet. Ball and socket joint maybe. So where two bones meet. So there he has some problem. That's a symptom. That's a symptom. Initially, he noticed this in a particular joint. Afterwards, maybe in every joint. In every joint, maybe more than one joint. That's it. First he noticed in one particular joint. Afterwards it became widespread. Hands, legs, everywhere. Okay, ankles, knees, elbows, wrist, shoulder, everywhere. Okay, hip. So joints. So which joints are there? What joints do you know? Okay, recall all those joints. Recall all those joints. Immediate. When you see joint pain, immediately you have to recall what joints. Which joint? Initially in one particular joint. Okay, you have to notice that one. One particular joint. Right. Question number 20. Yeah. So, now what are the joints? So we'll take shoulder joint, elbow joint, wrist joint, hip joint, knee joint, and ankle joint. So what joints? You can recall. Dear students, look carefully at the structure there. Look carefully at the structure there. The question is about location, a body part or area. Now Jason is describing the pattern of his joint pain. where it first appeared, originated, initiated, beginning, onset. Where did he notice it in the first place, and how it spread from there onwards, then onwards? That means your answer will be a noun, a body part, a body part, a noun, one clear specific area. Now read the question carefully. Joint pain initially in which body part? Now widespread. We don't want about widespread because already given that many are there. We don't want all this. Starting where? That's your signal. Initially. Initially. That means in the beginning. First and foremost. In the very first onset. So remember that one. The origin. The beginning. It started. It began. So these are the words. Initially is the clue word. Don't expect the same clue word. Now I'm talking about synonyms. Synonyms. Initially means firstly, in the beginning. It began. It started. So like that. It first was noticed. He may tell in any way possible. He may say in any way possible. You have to be very sharp. So that is the word. If you get any word related to this, that means you got the answer. Keep your ears ready. You have to start listening now. Till now you heard. Now you have to listen with care. All ears. Okay? You have to smell the word, you have to taste the word, you have to see the word, you have to listen the word, everything. You have to feel the word. All ears means all five senses. Okay? Remember that. Now, what is that one? Now, immediately you brainstorm. Joint pain. Joints. What are joints here? Joints, knees, fingers, wrists, shoulders, ankles, back, hip. Okay? All these things. Any joint. Any joint. Okay? So you have to be ready. When you hear this word, only one he will tell in the beginning. Afterwards, now he can say reverse angle also. Now I feel everywhere. But let me tell you, in the beginning, this pain started, in the shoulders. First he will tell, I am facing pain everywhere in my body, in all the joints. I feel very tough now. But let me tell you one thing. Oh, let me recall. In the beginning, I got this pain, in the beginning. So initially, there is the answer. When you are ready for this answer, that means you are not going to miss anything. Anything. I told you will get 12 out of 12 if you listen. I did not show you any answers here. I'm just going you directions. If I put a thread and I tell you catch this thread and go, you will reach the destination. That's it. You catch the thread and you go. Automatically you reach that. If you miss the thread, you will lose that way. You will not reach the destination. I'm only giving you the way. I'm paving the path. I'm paving the road. You just have to travel on that road in the same manner. That's all. The road is correct. But whether you are traveling in the right path or not is your problem. Be careful. Don't go to the left. Don't go to the right. Whatever I taught, follow those patterns as far as possible. You cannot learn it overnight. It takes time. A baby boy born today cannot scream mama on the very first day. It takes time. It takes time. So be careful. So don't think tomorrow I want to do all the questions. So or still I cannot get 6. What? What? How can you be perfect overnight? You need practice. I'm just teaching this is only the beginning. I'm just putting the foundation. You go on building bricks on that one. Every question you think in this angle. Okay? Think in for the first 5 days. Don't play the audio. Take the question paper and start thinking like this. Make notes, make notes, make notes. Let your brain be triggering very fast. So train your brain. Train your brain. Then after doing all this background work, then you start listening and then you do. For the first 5 days, 7 days, no problem. Those who have exam in 12, 15 days, you do for 5 days. Those who exam on the 20th, 29th, you do for 10 to 12 days. Like this. You will master this one. And I'm sure you will get 12 out of 12 every time. Okay. Then afterwards, slowly, that time will get reduced. You will be very fast. And afterwards, after 1 week or 10 days, then you don't need to take extra time. In 30 seconds, you will finish off. Okay. And if you do for 20 days, afterwards, you don't need that 30 seconds also. On the spot, you can guess the answers because your brain is filled with, if your fridge is filled with vegetables, you can cook any dish you want. Now your brain is the fridge, refrigerator, and any dish you can cook because the fridge is filled with all types of vegetables. If there are no vegetables in your fridge, what will you cook? So fill your fridge, refrigerator with vegetables so that you can cook during the exam. I think you can understand me properly what I'm talking. So that's question number 20. So brainstorm. Now let's predict logically. Jason has had a long-term chest problem. He had a sedentary lifestyle, possibly on medication. Then he starts experiencing joint pain. Where do such pains commonly begin? Commonly for knees, especially for sedentary adults. Then wrists or fingers, early arthritis. Shoulders, repetitive strain or posture related. Ankles, weight bearing issues. So these are the points which you have to think like this. So what are the areas which pain will begin? Okay, early. So now, always use your medical reasoning, even in listening. Don't think this is English. You have medical knowledge. This is medical subject. So whatever don't start from zero. You are already master in medicine. You are master in nursing. Okay. So why do you bother? You have a lot of knowledge about all these things, what I am talking. I don't have, but you have. And you are experienced also. You studied 4 years on this. I did not study anything. I don't have any experience as a nurse or a doctor. When I am able to speak so many things, what about you? You have studied for 4 to 5 years. Then afterwards, you have so much experience. So never start from zero because you are already filled. Your refrigerator is filled. But you don't bother to open the refrigerator. That's the problem. Remove the cap of your brain or skull and search inside. Lot of things are there. Whatever I am teaching, you already know. I am not teaching anything new. I'm not teaching you anything new. I'm just making it systematic. It is new to you. You think, but it's not new. Nothing is new. Everything you know. But I'm only streamlining it for you. And I'm telling this you are missing. You're not bothering. You only want to write the answers. You don't want to poke your brain. You don't want to put your hand in your brain. That's the problem. Put your hand in the fridge. Everything will come out. You are not trying to open. So that means you are lazy to open the freezer, refrigerator. Don't be lazy. Be confident. You know everything. That's the final tip I want to give you. Be confident because you have the subject. Be confident because you have the knowledge. You are a medical professional. Remember that. Do you want me to remind you that you are a medical professional? Don't you know all these things? Mind you, you deserve 24 out of 24. That's it. Then next. Now here, always use your medical reasoning. Even in listening. If the pain is now widespread, it probably started in one or two small joints. One particular part. Maybe both the knees. Then afterwards everywhere. The pain started off in my, that's what he will start. Started at first, initially, in the beginning. Okay. So these are timeline we call it, timeline. Initially, In the beginning, first, it started. Now, after that, later. First, next, then, later, after that, finally. Finally, I have everywhere, but initially some. So, first, last. Now is the last. First is the first. So, where it first? So, that is timeline. So, try to understand what are the other synonym words which you use for the word initially. Then you can catch the word and you can get the answer. Just like that. Just like that. You see a lizard catching a fly. Just in a, not even a second, even a split second, the tongue will go that far, catch the fly and come back and in the mouth. You will never notice. Just like, have you ever seen its tongue at the fly? Like that you will catch. As if you are in dream, you'll get the answer. That's it. Then next, 21. Okay. So that should be a body part. If it is a body part, it's right. If it's a body part, it's right. If he says arthritis, no, it is wrong. If he says muscles, it is wrong. If he says muscles, muscles is not location. Muscles, not location. Arthritis is not location. Okay. Wrist is a location. Joint is, ankle is a location. But arthritis, you'll hear the word arthritis, but you should not catch that word. You'll hear the word muscles. Muscles are not location. Okay. Muscles, not location. So don't. That doesn't fit. Next, 21. Treatment. 21 is treatment. Yeah. Treated with analgesia plus something else. This plus that. Okay. This plus that. So this and that. So one is analgesia and another one is something else. So this is breathing problem, pulmonology problem. So some inhaler maybe, some cream maybe, some powder maybe, some injection maybe. So something else related to this one. So you have to understand treatment given. So diagnosis over, afterwards treatment. Okay. Now you see a structure like this, treated with dash plus dash, treated with A plus B, both treated with A and B, treated with not only analgesia but also something else, treated with both analgesia and something else. So try to understand this. So this is something exercises, okay, breathing exercises, stretching and strengthening exercises maybe, or injections maybe. It may be anything. It may be anything. Maybe physiotherapy, okay, maybe hydrotherapy or something else. So main treatment and supplementary treatment. Analgesia is the main treatment. To support this one, there may be some other treatment. For example, diet, diabetes diet. For example, we have insulin injections, and you also ask diabetes diet and some exercise maybe. So like that. So main treatment and secondary treatment and tertiary treatment plus this one. Not only this, but also something else in addition to medication. This is not enough. There is something more needed, plus more needed. So first main and the secondary branch. So what is that secondary branch? You have to understand here. Okay. Now, it's a signal word. Plus means in addition to that. Furthermore, moreover, and Not only but also in addition to. First he was treated with analgesia. He was also, so also is plus. Additionally, he was given physiotherapy treatment. So try to understand here. So he was treated with analgesia, yeah, plus. Now you think about this one. Plus means immediately after that, first one main is analgesia, and immediately after analgesia, something else was given for treatment. So what is that second one? Main will first come first, and second one will come next. Naturally, the order will not shift here. Secondary will not be told first. Main will is analgesia. In addition, secondary this, right? So now let us see that one very clearly here. First, what you will hear, it will be like this. He was treated with analgesia plus. And then you will hear the name of another medication, therapy or approach or treatment modality. Use the advice clue, the voice, what it says here. The answer comes just before a word a patient is likely to use instead of analgesia, some other word. So try to understand this. So in the recording, he may say, they gave me some painkillers. And painkillers means what? Analgesia. And your answer will come immediately after that. So analgesia doesn't mean that he will say analgesia again in the audio. Is he crazy? He's not crazy. Analgesia, same to same. What is the use? What you are doing? Then you are a small KG boy, grade 1 boy. You're a doctor. Don't expect ordinary things for extraordinary students. Do you think OET will give ordinary things to you? Here analgesia, there analgesia. No, he will say like this. Okay, what? Like painkillers or pain medication. That's it. Instead of analgesia, he used some other words. Okay. So the answer comes just before a word a patient is likely to use instead of analgesia. So that's clever. It means the word analgesia itself might not be used by Jason. He will say some analgesia, who will use? The medical professional will use. But the patient will say he gave some tablets or he gave some injections. He gave some capsules. He gave some painkillers. I was treated with some painkillers. He will say painkillers. He will not say analgesia. He'll say something else. He'll say pain medication or pain relief. Something else he will say. That means analgesia only. So you have to relate this analgesia with that painkiller or pain medication. So one is already given now. If you relate those things, the next immediate word will be the answer. They gave me some painkillers and. So the answer will come immediately after and. Now let us focus on grammar now. So painkillers is noun phrase. Plus means and. The next word also should be noun. So what are the nouns here related? Treatment type nouns. Treatment type nouns. Because it is treated with some treatment modality. It may be physiotherapy. It may be anti-inflammatories. It may be steroids. Maybe vitamin supplements or something else. Or exercise regimen or exercise program or a dietary regimen. Okay. So that's what it is. Be ready for all these options. Don't just look at the audio. Where is the answer? Where is the answer? My God. I prayed to God, but I am not able to catch the answers. No. God will give you brains. God will give you wisdom. But the brain, use the brain and use that wisdom and get the answer. God will not give you the answer. God is giving you brain. God is giving you wisdom. But use that wisdom, use that brain and get the answer. That's it. So don't just pray for the answer. Work, struggle. Right. Food is there in front of you. You have to take your fingers, put it in the rice and pick some rice grains and put it in the mouth. Then only you can. How will the grains go into your mouth? Work, struggle. What am I doing? Why these people like me? Why they come in so much? Why they like me? Why they love me? So you have to put hard work. Of course, this I'm 55 years old man. And in the middle of the night, I'm sitting for you. I'm doing a lot of hard work. Why? I need something. I need something. So I'm doing work, hard work. You also do. You need your results. You do your hard work. You do your hard work. That's it. Work hard. Be serious. Be dedicated. If you put your interest in work, you will get salary. If you put your interest in studies, you will get results. You want that money and you want these results. That's not possible. So give as much time. I'm not telling you stop your work. Okay? It's multitasking. Focus your brain on your studies. Within 1 month, you will get. That's it. This is a challenge. Many people, they do go for duty 12 hours and they pay the exam, suddenly go in the exam and they write something and they come. No, that's not fine. 22nd. So now let's think about like clinicians, brainstorm, 21 brainstorm. Now, Jason has joint pain that became widespread. Now it's being treated with analgesia. That is alone is rarely enough. Now this is joint pain. Joint pain mostly will be related to physiotherapy or steroid injections. So what might be added to the already existing pain medication or analgesia? What can be added to that? You think as a physician, as a clinician, as a doctor, as a professional, as a medical professional, as a nurse. You think what are the additional things that are given in addition to the analgesia? Anti-inflammatory drugs, physiotherapy, steroid injections, stretching exercises or exercise program or dietary regimen, guidelines, whatever. So that's it. They gave me some painkillers and put me on an exercise regimen. Something like that. Immediately after or plus, then you'll get the other word. Painkillers, analgesics, pain medications, pain relief, all these are relative synonyms. Be ready. The same words, analgesia may not come again in the audio. So that is where you people suffer. Be ready. Be ready. Be ready. You are standing in one position. When the person is hitting the ball or throwing the ball, if you stand like that, ball you cannot catch. You have to run, chase, bend, fall down, or jump in the air. If it is going above your head, you have to jump. If it is falling before you, you have to run forward and catch. Even fall down on the ground. If it is going sideways, you have to run and jump sideways. How to catch the ball? You have to be very active. We don't know which word will come where. We don't know which ball will go which side. First ball will may go cricket, tennis, whatever it is, game, football. The ball may go to the right or left or front or back or above, whatever it is. If you can't use your leg, use your head also. That's it. But you have to hit the goal. That's it. Bend. Be flexible. Be flexible. How can you be flexible? When you are ready to jump any side. So now in the words also, be ready with your vocabulary. Be flexible with. How can you be flexible? Learn the vocabulary. See how I am giving you the words. Like that you also learn the vocabulary. Because unless and until you learn the vocabulary, mastering listening is very difficult. Reading, at least you can go again and find the word. But in listening, tape plays and it doesn't return. No second listening. One time and it's gone forever. You're lost. So be very careful. So, final reflection you have to ask. Does my answer name a treatment, therapy, or drug? If yes, it's perfect. If it is saying something like pain, joint stiffness, or a symptom, not a therapy, then that's wrong answer. So be careful. Immediately you have to, mind should be So they gave me X and Y. So one is already given X, and what is Y? You have to find out. That's it. They are linked therapies. One therapy plus another therapy. Normally it will be medication, exercise, and dietary regimen. This is the order. Medication is the primary treatment modality. Exercise is the secondary treatment modality, and diet is the tertiary treatment modality. They go together. And sometimes three of them go together. Three of them go together. That's it. So be careful. Okay. Here we have only the second one. Okay. All right. Because joint pains, joint pains. So analgesia and some exercise maybe. Okay. Right. Now, 22. 22. Now look at the question 22. Sedentary lifestyle. So in the 30 seconds, if you see, these last points also help in the beginning. First points also help in the beginning. Ending like that. If you go through everything in 30 seconds, you will have a full picture. If you don't look at this and directly wait for the audio, you will have zero knowledge about it. You don't have anything. Don't have any foundation. Then it will be very difficult for you. 1 second, please. There are some people who ask me, sir, you take a lot of time to explain. What lot of time to explain? Be happy that somebody is explaining in depth. One lecture is enough. No need of 10, 20 tests. One test is proper. That's 100% perfect. And go on practice. Right. Next, 22. Sedentary lifestyle works as a dash. Sedentary lifestyle. So he leads a sedentary lifestyle. That means he is a fixture. He doesn't walk much. Sorry for the inconvenience, some network issue. So, right. So here it is. Yeah. So, sedentary lifestyle. What do you mean by sedentary lifestyle? He's a fixture. Sedentary means immobile, couch potato, does not move from place to place. The reason is joint pain. Oh, if I get up, my joints pain and I fall down, I'll get hurt. I cannot walk. It's very difficult. It pains too much. So why should I stand up? Let me sit here only. So try to understand what is this. So because of this pain, his lifestyle is earlier he was very free. He'll move from one place to another. But now sedentary life, it's but the joint pain, radiated everywhere. Widespread all over the body. Every joint aches. Now, If he bends also, he has pain. If he stands also, he has pain. If he sleeps also, gets up, turns the bed also, he has pain. So he has a sedentary lifestyle and works as a dash. His works as a dash. And sedentary lifestyle will suit that one. So that's why his lifestyle is sedentary. He doesn't move normally. That's why his joint pains also maybe. Vice versa. Okay, fractured femur in skiing accident. Closed reduction 5 years ago. Okay. First one is sedentary lifestyle. Then he works as a, so similar position, one place, in a fixture, in a chair, okay, office table, desk job. He doesn't go here and there. It's not a field job. He sits on one place from morning till evening, that's all. Maybe like computer operator or something like that. He's not a salesman, definitely. Because salesman's life is not sedentary. Or a cashier. Even a cashier will go get the cash, come here, go there, something like that. If he has a doubt, he goes to the manager, something like that. But this is a sedentary lifestyle. He doesn't move. Okay, watchman. Yeah, watchman, he moves here and there. So what is the sedentary lifestyle? Try to understand here. What is the name? Works as a. So what is his profession? What is his job? What is his occupation? What is his vocation? Okay. What does he do for his living? So these many things you can use. See, suddenly why it is coming out of my mind? Your mind should be sharp like that. That's what I mean. So sedentary lifestyle means, so let us decode the meaning first. Sedentary lifestyle means sitting for long periods and little physical activity. Little physical activity. So Jason's job is something that involves sitting most of the day. Perhaps office work, computers, or administrative duties. Now use the advice clue 22. Be careful. Jason doesn't use the words work or job. He doesn't use the word work or job or employment or something else. He uses some other word. And the answer comes quite quickly after the question 21. Immediately. Okay. Immediately after the question 21. There is no gap in between. Like for question 23, there are 2 lines gap. Like that, it's not there. Question after question, immediate 20, 21, 22. Tuck, 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 they are coming. So immediately the next question is coming. So if you see this one, he is not going to use the word work or job. So some other word he will use. Okay. He does not move on one place where he works on the computer, something like the, okay, he works on the computer, so computer operator. So like that. Then, so he may say, I am in IT. IT. He works as a IT professional. He says, I am a software developer. He works as a software developer. He doesn't say I'm working or job or employment. He doesn't say all these things. I am in IT. Okay. He doesn't use the word directly work or job. He will say, I am in the IT department. So he works as an IT professional. Okay. Or I am a software developer. So works as a software developer. He doesn't say work. He doesn't say job. He doesn't say employment. He says, I am a software developer. Where is the word work? Immediately the word will come and it will go. And you are looking for work, work, work. So immediately you have to catch that word. I sit at a desk most of the day. I do data entry. So that I do data entry. So he works as a data entry operator. Okay. So you have to understand. I am in IT. So he works as an IT professional. So an IT professional will not come here. because A is there. So A software professional or software developer or software engineer, something will come like that. So you have to be ready for those modifications very fast. Then, so the answer will be hidden inside his natural phrasing, not in a textbook sentence. As it is, they will not speak. So grammar. Now, A is there. A teacher. A teacher, right? A accountant, no. A account, no. An accountant. So A accountant will not come. Office clerk. A office clerk, no. A clerk, okay. But A office clerk, no. A driver, right? Correct. A engineer, no. An engineer, not a engineer. Why? Because A is here. You should understand the words sounding A, E, I, O, you will not fit here. Accountant, office desk, office clerk, engineer, they will not come. Software developer, yeah, a software developer, yes. A software engineer, but a engineer wrong. A software engineer is right. Okay. So like that. So that's it. Now brainstorm and fit it. So desk job, maybe, or computer based work, administration. So a administrator, no. A office administrator, no. A company secretary, yes. A secretary, yes. A manager, yes. A clerk, yes. So you have to think. So possible answers can be company worker, software engineer, right? Head office accountant, data analyst, like that. So this is the way how you have. Remember, this part of the listening is not medical. It's a lifestyle. Sedentary lifestyle. It's a lifestyle. It's not medical related. It's casual. It's a lifestyle. So don't think that medical words will come here. It's a lifestyle. Don't switch off just because the topic sounds casual. These questions are simple but easy to miss. Don't take these things very lightly. This is nothing. This is not very serious question. Don't think like that. You can easily miss this if your focus drops. So be very careful. Now focus on what he is going to say. I do accounting, so I am not very active. I am mainly office based. I am in IT, so I sit at a desk all day. So this is the way how he will speak. Then try to understand the word, what he speaks there. So when you hear Jason talking about his daily routine or a type of work, because this is related to work, it's not about every lifestyle. It's about his work, especially the question is about work. Lifestyle may be many different things, but this question is concentrating on work. So let us focus only on work. We need not bother about other areas. Right. Next. Question number 23. Question number 23. Now let us see question number 23 here. So no need to bother about NB, fracture, femur in skiing accident, femur, closed reduction 5 years ago. No need to bother. Next, family history, father, disease, emphysema. No need to bother. So here, forget. When he says maternal, grandmother, immediately be ready. Next question is coming. Grandmother, finished. Maternal grandmother had a dash. So what is the medical condition? What is the problem? What is the disease or sickness or ailment she had? Maternal grandmother. He will not say maternal. Okay. His grandmother from his mother's side or his mother's mother. Some other style he may say. Had a dash. What did she have? So what is the medical condition? Now here, you have to recall immediately. It's a family history of medical problems. All medical problems, nothing else. So let us focus on the structure here. The blank follows the word had. Had means what? Past tense. Had something. Okay. For us now. So your answer must be a noun phrase naming a disease or medical condition. For example, diabetes, rheumatoid arthritis, or just arthritis, or high blood pressure, or low blood pressure, or osteoporosis. Try to understand and try to analyze what medical condition she has. So she was diagnosed with. That's the point. She had means she was diagnosed. Right? How do you know that she had? Because she was diagnosed. If she was not diagnosed, how will you know that she has this problem? So if doctor diagnoses me that I have diabetes, then that means I know. If the doctor does not diagnose, how do I know? Or how will anybody know? So diagnosis is done, that's why they know. And they're saying it's a fact, had something. I have a pen, that's a fact. Okay. If I know only, I can say. If I don't know, how can I say? That's it. So, had some medical condition. So, high blood pressure or osteoporosis. Now, use the advice clue. The name of this medical condition has two words. So, advice says like this. There are two words that aren't easy to spell. So, spelling problem is there. So, don't worry about the spelling. For example, emphysema is a tough word. Maybe you don't know the spelling. Not everyone knows the spelling. Many people don't know the spelling of pneumonia. They will write N-E-W. N-E-W. So spelling is a problem. Some spellings are excused. Not always. Right? So, two-word medical condition. Like rheumatoid arthritis. Type 2 diabetes, mellitus. High blood pressure. So like that. So it may be chronic bronchitis or rheumatoid arthritis. It sounds complex. Maybe bronchitis or rheumatoid or arthritis. Spelling mistakes may be there. So first what you write? Rheumatoid arthritis. R-H-E. So finished. R-H something. R-H. Rheumatoid. Arthritis. A-R-T-H. Finished. Write shortly. Then afterwards you can write. Think about the spelling and write when the audio is stopped. So you don't need to worry about perfect spelling now. Just write what you hear clearly. Okay, he had. That means must be a diagnosis. Something a doctor would have officially diagnosed the grandmother with. So it's not pain, it's not trouble walking. Those are symptoms. We are looking for a proper disease name here. So now let's use the logic by brainstorming and predicting. Jason's own case is respiratory and joint based condition. COPD, joint pain, and his father had emphysema. And his mother, question 24, has also medical condition. So, try to understand here. So, his maternal grandmother's illness is likely something systemic or age-related. Grandmother, maternal grandmother, she had. So, it is something like age-related or old age problem. Father is deceased, passed away. Maternal grandmother had this problem. Okay. Old age problem maybe. So old age problem may be rheumatoid arthritis or chronic bronchitis or osteoporosis or type 2 diabetes mellitus or chronic bronchitis, whatever. So two clear words, compound words, complex words, spelling problems maybe. So be careful. Okay. Is it a proper disease name? Not symptoms. There should not be symptoms. It should be a disease name. So think about it. Are there words like that? Fine. Now next, 24. Last question. Mother recently diagnosed with. That's the last question. So father, maternal grandmother, and mother. So diagnosed. This is diagnosis. Okay. Father was diagnosed with emphysema, mother was diagnosed with something, and maternal grandmother was diagnosed with something, and mother was diagnosed. So all are medical conditions, medical history. I told it's diagnosis. Okay. It's perfect diagnosis, 100% clear, confirmed. The word recently is your clue. Recently. The same word recently may not be there. A few days ago, 2 weeks back, last month, previous fortnight, last Monday, something like that. So, think about this one. Recently, it means the condition is new, something diagnosed not long ago. So, the speaker will likely say it in a matter of a fact tone, not an emotional one. So, use the advice clue, and the advice says what? Listen for another medical condition. It's only one word this time. So the advice is telling that on the right side, 24. Listen for another medical condition. It's only one word this time. It comes quite quickly after question 23. 23 is finished. You're already that spelling problem, big questions, complex question. Immediately another question is coming. So you have to finish fast. Write down the answer fast. Forget about the spelling. Afterwards you can correct the spelling. So mother recently diagnosed with what? So within 2 to 4 seconds, immediately this will come. You are most likely to miss this answer. Okay. So it might be, the blank must be a noun, a disease name or condition. It's not a symptom. It's not a description. It's just one clear medical term. For example, hypertension, diabetes, arthritis, asthma, depression. One clean medical word. Anything one. Because he has already given their help. Right. In OET, family history items are usually simple and common conditions. Words you already know because you are medical professionals. Medical conditions, they are common conditions. Stress, depression, anxiety, arthritis, diabetes, asthma, hypertension, all these things, blood pressure, all these words, common. So except something like this. How? My mother's just been diagnosed with, just been, means recently. Mom recently found out she's got. Okay. The key phrases are just been diagnosed with or recently found out she has. So right after those phrases, the very next word is your answer. So now, during listening, okay, focus on the question. No time. Immediately the answer comes. 24th question is little confusing. Fast it will come, this one. So, think about it. Logically, reasonably, and then guess, and then write. Listen and write. Spelling. For example, if he says arthritis, ARTH, enough. If he says type 2 diabetes mellitus, okay, you just write 2DM. 2DM, shortcut. So 2DM means type 2 diabetes mellitus. So now you can erase and write afterwards. Full. No problem. First catch all the answers like this. Once the audio stops, immediately you can go and check and write. And in the end also you will have 2 minutes. Okay. Right? That's it. So that's very fine. So remember once again, look at the question, think, dig your brain for possible options. predict what might be the related answer according to the situation. Then listen to the audio and write your answer. That's it. Look, think, predict, listen, write. These are the 5 steps which I have explained you so far. So that's a pretty long time. Now let us look at our friends, how they are going to do. We finished with the session. Okay. Where is my video? Zoom is unable. Okay, fine. No worries. Yeah. So let me unmute everyone. Unmute. Allow participants to unmute themselves. Yes. Okay, you can unmute. Now, one by one, we'll be speaking and you'll explain me. Finished. One full part A is finished. I have dealt with part A 100%. I don't have anything more to teach. I have more, but this is enough for you now because you people don't have much time. Okay. Now, first I finish part A. Finished. Then tomorrow we'll go with part A reading. Okay. So like that. Every day I'll teach you one part. So in 6 days, we'll finish. 3 days listening, 3 days listening, 3 days reading. So 6 days over. Writing one day, speaking one day. So 8 days over. So every day you will do one test and you'll send it to me. You'll check and you'll tell me. We'll update the results. I have sent you materials. You can print them and keep them ready. Okay. Personally, if you have anything, request me personally. And if you have anything in a group, you can discuss in the group. And yes, so as I have mentioned you earlier, I have 2 places still. So I'm going to close, right? There are some students who said my friend is there. If your friends are there, you can message me. So I can follow, you can tell them to message me and you can message their names. I'll look it after. So already I gave introduction. Listening is over. I told you, no? So if you delay, after 2-3 days, almost everything will be finished. So no use. Okay, joining in the late. So that's why I told finish it off fast. You finished and you are joining here. So anybody is there, missed this session, I will give them some other manner. But if they are interested, you can ask them to contact me, right? If your friends are there, if you know them, that they are serious. You know, our classes are very serious, very serious. I was not well last week, a little bit. Okay. And God bless, everything is fine now. And so new month, new beginning, everything all new. Fine, you can go ahead. Don't worry, I'm with you. Trust me, follow my suggestions, do everything well. So if you have friends, you can recommend me. Today is the last day for admission. Afterwards, no admission. Even if they give double the fees or 2 times the fees, I'm not going to take their admissions. That's it. Right. See, you know how much I'm straining. If I take somebody else afterwards, I'll get headache. So that's why I don't take. Limited students, that's all. Yeah. Now let's start with our doctor. Let us give doctor first question and he will speak. Yeah, doctor, share your experience fully.
Hello.
Yeah, go on.
Yeah. It was fantastic. It got explanation in deep details. It was. I think it's very helpful.
Right. What is your suggestion? Shall we take reading or reading part here tomorrow full?
Yeah, it is good to have reading part A tomorrow.
Yeah, tomorrow same test. One reading I will explain from the same book. So
Okay, that's
all of
good.
you
Yeah, the same.
print the question paper and keep it with you.
Okay.
All of you. Yeah. Next. Next one. Yeah, Odeon. Odeon.
Good evening, sir.
Yeah,
Good
what
morning,
is
sir.
this, Simon, sir? Oh my God, non-stop nonsense. What is this, sir? Come on, tell me.
No, it's fine. The class was awesome. I enjoyed it, and I'm really happy that today I'm happy to be at home. Tomorrow I'll be going back on my night shifts, and then I don't know when I'll be able to join this group until when I'm off again and the class is holding. I had to take the opportunity today to be in class, even though I have been very tired. I've not rested, but I told myself I can't miss this class. I have to open my two eyes and watch and listen. And that I have done. And I actually enjoyed the class from the beginning to the end. From your explanation, it looks so very much easy to get the answer correctly when you're listening to it. So I'm going to keep practicing, going through listening to them when they are talking, before then brainstorm the answer, and then I listen to what they have to say before I will pick my answer. Thank you so much.
That's
It
very
will
good.
help
You
you
said
avoid.
your friend also is there, right? You can tell him. Okay. If he
Okay,
misses today, no admission for him. Even that discount, which I told, he will not get that discount if he comes afterwards.
okay, all right.
Tell
I
him
will.
very clearly because everything is going on fine, right?
Yes,
You
okay.
discuss with him or her and tell them, I have given
Oh,
good discount and they can come and join. If tomorrow, after today, later they come, no. Okay?
okay, sir.
So
Thank you,
next
sir.
batch again after 15 days. So that's the problem.
Okay, sir.
Because once I finish this session round, then I can take another one. Otherwise, I cannot. Nah? So you people
Okay.
will suffer if I take more. No, I will not risk that one. So next, Dunisha Pereira.
Hello, sir.
Yes,
Yeah.
Dunisha. What is
Yeah.
this, sir? We are doing 12 hours duty, sir. You're taking how many hours, sir? When will we sleep, sir? What is this, sir? We asked
No,
teachers and you are giving us this big problem, sir. Oh my God, what is this, sir? Come on, tell me.
no, sir. Actually, I got a clear idea because now I can understand how I find the answers. Sometimes just hearing that audio and I try to find the answer is sometimes struggle with that. So now I have a clear knowledge about that. Thank you for guidance, sir.
Very good. All of you wait. I'm going to play the audio. I'm going to play the audio. You will get 12 out of 12 or not check. I'm just distracting you so that your mind will focus a little bit. Now, till now, there was brainstorming session. So immediately if you do the test, now it will be panic little. So that's why I'm just relaxing you so that I'll start the audio. So don't go. Okay. So my students will never leave the class and go unless and until there is a serious problem, they will not leave. There are students who attended the session for 7, 8 hours also. Okay, you can see my videos, very long videos, but 100% clear, perfect. Like that, I will explain. So don't miss any session in between because you lose the flow. Next, Dunisha, Dinusha.
Yes, sir.
Yeah, Dinusha.
Uh,
Maybe
yeah,
if your family members, if your son or daughters, they see me, they'll come take a stick and come behind me. Huh?
no, sir.
Tell
Uh,
me.
actually, I got the clear picture of how to take the answers for this question because before I didn't have any idea. I just listened to the extract and tried to get the answers. But today I learned how to uh, predict the answer correctly. Thank you,
Okay,
sir.
very good. Very good. Right. Then next we have Cincy. Cincy.
Hello, sir.
Yes, sir.
Thank you for the session today, sir. Actually, today I got the clear idea how to identify the answer because before I struggle with every time because sometimes we didn't put the A and N like this. but it is very mistake. Now I know how to take the answer. Actually, it is. Thank you so much for the session today, sir.
Right, good. Good. Next, we have two guests we have. One is Josephine. Hello, Josephine. I am pleased with you. If you are interested, you can request me. Okay? Because you are very serious. I can understand. You have attended the full session. So if you are interested, okay, you can attend every session now. This was an open session, so I gave you openly. So from tomorrow onwards, this will be regular session. So if you are interested, you can request me for daily sessions. Yeah. Josephine, you can unmute and speak. What is the benefit you got? Yeah, Josephine, do you have anything to say about your experience? Okay, Josephine is busy, I think. Maybe at work or something. Just message me. Anuja, Yanagama, I think somebody in here. Very good. Come on, Anuja, tell me about your experience. Yeah. So, Anuja, you can unmute and speak. Josephine, you can unmute and speak. Otherwise, if you are not able to speak, then you can just send a message to me. Okay. Next, I'm going to play the audio now. Get ready. Yeah. Jason Weiss. Get ready. Right. So this is Jason Weiss. Jason. So Anuja Lianage. Come again. So you're not able to unmute. Okay, no problem. I will try. Yeah, now you can try unmute. Yeah. Can you? Okay, no problem. You can send a message. No worries. You can send a message in the chat. Otherwise, you can send a message to me personally on my WhatsApp. Okay. Now we are going to the audio. This is the second audio.
Extract 2, questions 13 to 24. You hear a primary care physician talking to a new patient called Jason Weiss. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Jason, I understand you've just moved to the area. I've got some notes here from your previous doctor, but it would be good to hear things from your perspective. Perhaps you could start by telling me a bit about any illnesses or treatment you've had, and anything else it might be useful for me to know.
Well, my current problems all started about 18 months ago. I went down with a bad cold that quickly turned into a chest infection. I thought it was just a bug that was going round, but it was quite bad, and I was having problems breathing. It's hard to describe, but I had a sort of stinging feeling in my chest whenever I breathed in deeply. Anyway, I did gradually get better, but I was left with a dry cough. I just couldn't seem to shake it off. It wasn't there all the time, but just when I thought I was all back to normal, it would suddenly re-emerge. That happened a number of times. After that, I started to get other symptoms. I'd lost quite a bit of weight without even trying. I noticed that my trousers were getting really loose, but I was eating normally. And I was sometimes getting this strange feeling in my throat, as if I wasn't swallowing properly. Then, at night, I'd suddenly wake up with a really bad taste in my mouth. Anyway, I went back to the doctor about that and was told I had a hiatus hernia, as well as a mild case of GERD, but not to worry about it. But when I mentioned that I was still getting the chest problems, she decided to make a referral to the pulmonologist.
And did you have some tests?
Yes, a number actually. The first one I had showed I didn't have asthma. I didn't really think that I would have, but they explained how they needed to rule it out. I also had a high-resolution CT scan. I think they said they wanted to see if I'd started to show signs of pulmonary fibrosis, but again, that came back clear. What it did show, however, was that I had hyperinflation in my lungs, and they came to the conclusion that it was probably mild COPD. I was asked lots of questions about my lifestyle, now and in the past.
That's good. And recently you've been getting other symptoms?
That's right. I've been getting pains in my joints. It was just the odd twinge initially, but it's been getting...
One second. Dr. Shams,
Yes.
are you able to hear the audio?
I'm not able to hear the audio, and also the screen is not show the question. That
Can't hear. Okay, one second. Some problem occurred, I think. One second. One second. Sorry.
The doctor thought I'd better... Again, it's just something, and it doesn't seem to be... Sometimes feel it in my knee. She gave me antibiotics, and it cleared up okay. But then I started getting a pain, in my shoulders mostly, though I do say all the time.
Sure. Well, thank you for all that background, Bryn.
Can you hear now?
no.
Extract 2,
Now.
questions 13 to 24.
Can you hear now?
You hear
Yes.
a primary care physician
Okay.
talking to a new patient called Jason Weiss. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Jason, I understand you've just moved to the area. I've got some notes here from your previous doctor, but it would be good to hear things from your perspective. Perhaps you could start by telling me a bit about any illnesses or treatment you've had, and anything else it might be useful for me to know.
Well, my current problems all started about 18 months ago. I went down with a bad cold that quickly turned into a chest infection. I thought it was just a bug that was going round, but it was quite bad, and I was having problems breathing. It's hard to describe, but I had a sort of stinging feeling in my chest whenever I breathed in deeply. Anyway, I did gradually get better, but I was left with a dry cough. I just couldn't seem to shake it off. It wasn't there all the time, but just when I thought I was all back to normal, it would suddenly re-emerge. That happened a number of times. After that, I started to get other symptoms. I'd lost quite a bit of weight without even trying. I noticed that my trousers were getting really loose, but I was eating normally. And I was sometimes getting this strange feeling in my throat, as if I wasn't swallowing properly. Then, at night, I'd suddenly wake up with a really bad taste in my mouth. Anyway, I went back to the doctor about that and was told I had a hiatus hernia, as well as a mild case of GERD, but not to worry about it. But when I mentioned that I was still getting the chest problems, she decided to make a referral to the pulmonologist.
And did you have some tests?
Yes, a number actually. The first one I had showed I didn't have asthma. I didn't really think that I would have, but they explained how they needed to rule it out. I also had a high-resolution CT scan. I think they said they wanted to see if I'd started to show signs of pulmonary fibrosis, but again, that came back clear. What it did show, however, was that I had hyperinflation in my lungs, and they came to the conclusion that it was probably mild COPD. I was asked lots of questions about my lifestyle, now and in the past, particularly about smoking, and, of course, my father loved his pipe, so I guess I was a passive smoker throughout my childhood. I've never actually smoked myself, though.
That's good. And recently you've been getting other symptoms?
That's right. I've been getting pains in my joints. It was just the odd twinge initially, but it's been getting progressively worse. It started off in my knees, but I'm now getting the same sort of feeling in my wrists and ankles. I've been going to physical therapy and taking painkillers, but I've not noticed any great improvement. But you see, I'm a train driver, so I'm not getting a lot of exercise, and that doesn't help. When I was younger, I used to do a lot of skiing, but I had to give that up after I fell and broke my thigh about 5 years ago. I was lucky I didn't need surgery, but I was out of action for months. At first, I thought the joint pain was related to that, but now it's spreading, I'm not so sure.
And what about the rest of your family? Any health issues there?
Well, my father eventually died of emphysema, and that is a cause for concern. But I should also tell you that my grandmother on my mum's side had pernicious anemia. I'm aware that there's a family weakness there, on the female side at least, because mum's just been told she's got leukemia. That was a shock because it just showed up in a blood test. She's had no symptoms. I mean, it can't be very advanced, but it is worrying. Anyway, the rest of the immediate family are fit and well as far as I know.
Well, thanks for all that background, Jason. What I'd like to do, I think, is...
So check your answers.
That is the end of Part A.
Yeah. Now you are going to check your answers.
Okay.
Yeah. So 13 to 24. Thirteen to 24. Come on. So those are the answers. All of you, check your answers. Check your answers. Anemia, 2 spellings are there. Anyone you can write. Leukemia, both spellings. Anyone you can write. Now check your answers. Check your answers. 1 second. Yeah. Write down your marks. Write down your marks. How many marks? You can write. Scores. So Shams Arsalan got 11. Very good. Last time you lost 2 marks. And now you got 1 extra. Very good. Dunisha, 9. Dinusha, 10. Come on. Cincy, 10. What about the rest? So Anuja Liyanage. Liyanagamage. Anuja Liyanagamage. Okay, Liyanagamage. Okay, very good. So what about how many total? Total 1, 2, 3. 1. Anuja, Dinusha, Cincy, 3. Odian, 9. Okay. So Shams, Dunisha, Cincy, 3. Dinusha, Anuja, 5. Odian, 6. Who is missing then? Who is missing? Josephine, eh? Okay, Josephine. What are you doing, Josephine? You're there. Okay, maybe she's sleeping. Okay, fine. Right. Good, no problem. So 9, 9, 10, 10, 9, 11. Okay. So now, so that is out of 12. So total out of 24. How much? Come on, add the first one and the second one and tell me. Add the first one and second one and tell me. So Shams got 21 out of 24. Very good. Cincy, 22. Good. Dinusha, 21. Good. Come on, come on, come on. Others also. Dinusha, 20. Very good. Yeah. I don't know who are the lucky 2 people. Okay. So you can invite your friends. So we are closing the admissions today. So you can tell your friends, whoever is interested. So now highest mark, Cincy. Wow, Cincy, 22. Cincy, unmute and tell me, what did you feel now?
Actually, I'm very happy today, sir, because before I didn't got the 22. Every time I'm got the 18 and 19 like this. Now I know how to get the answer. Thank you so much, sir.
Very good. Okay. So next, second place is Shams. Come on, Shams, tell me, how do you feel? 21 out of 24.
I got 21. Yeah, I'm happy today. You explained in details. I think this was helpful to get mark.
Right. Thank you. Dinusha, 21.
Yes, sir, because of your method, I got the answers, but the problem was with the spelling. This time also I got the answers, but the spellings were wrong. So
Yeah, very good.
actually, your method is easy to catch the answer. So I didn't improve my spelling.
Good, good. Yeah. Dunisha.
Yes, sir. Yeah, the same problem. I got this 13 to 24. Actually, I identify 11 answer, but the spelling, that's why I got the 9. But and also I'm happy because I got almost altogether 20.
Yeah. Right. Slowly, slowly you'll improve that also. Okay.
Yes,
Yeah.
sir.
Odeon.
Yeah. Yes. Number 13. I actually spelled it wrongly. That's why I missed that one. And then I missed number 23. Instead of the spelling also, pernicious anemia. I spell it wrongly. And then I think I missed one. I totally missed number 21. I didn't hear what the person said, but it was physical therapy. So I missed that one out. That's why I got 9.
Very good. So now it is your 12 o'clock, midnight, right?
Yes, sir.
So I am also going to sleep along with you now. You understand? And
Okay,
tomorrow
sir.
when you wake up, you message me, okay?
Okay, sir. Thank
And
you,
in the
sir.
early in the morning, don't press me. You just send a message and I'll follow it up, because I also should prepare also. No, a lot of things are there, right?
Yes.
So you send a message. I'll tell you what you have to do and what I have to do, what time we can schedule like that. Just when you get up and you send, sir, I am going to duty. Sir, this is now, I got up, we can have our session like this or something like that. I am free from so and so time to so and so time. Whatever you want to write, you write. So that is like good morning to me. So I will understand and follow that you are interested, you are available, and I'll schedule something for you. Personal sessions like speaking and writing, like that one. Okay?
Okay, sir.
And I'll also
Thank
schedule your tests also. I'll also schedule your tests. So tomorrow, good night. See you. Bye-bye. Have a nice
Good
day.
night. Thank you, sir.
Thank you, sir.
Right.
Thank you.
Right.
Yes, sir, thank you.
So those who are watching on the YouTube, this is your day. We have last two places for this batch because we already started the batch. Right. So we are done with the listening part here already. And tomorrow we are going to do with the reading part A. So if anybody is interested, you can contact me personally on my WhatsApp number. So here, comment. Those who watch the video.
Got something on your mind? We'd love to hear from you. Type your thoughts in the comments below because your voice helps us grow and it might just help someone else too.
If this video added value to your day, go ahead and tap that like button. Your support keeps us inspired to create more, just for you.
Found this video helpful? Share it with your friends and colleagues because knowledge grows when it's shared.
Don't miss out on what's next. Hit that subscribe button and join our community, a place where learning, growth, and passion come together.
And don't forget to press the bell icon so you'll always be the first to know when a new video drops. Stay connected. Stay inspired.
Up next, the listening test on gestational diabetes. Challenge yourself, test your understanding, and take one more confident step forward in your journey.
Admissions are in progress. As mentioned, we have filled up the lot with only 2 places remaining. Anybody is interested, you can contact me. Admissions are in progress for Grand Master class. Listening, reading, writing, speaking, all together or individual sessions. Contact the admin of Grand Master class at +91 98778 67360. WhatsApp me on +91 98778 67360. Personalized sessions, morning, afternoon, evening, and night. All medical professionals, new batches every month. Intensive training sessions, schedules for 15 days, 30 days, 60 days, and 100 days. Watch for the next episode coming soon, Grand Master Class. Practice makes man perfect. A test today brings success your way.